Okay, yep. We've started recording. So let's see, do we have, we should have the mayor.
Yes, I'm on, Doc.
Hi, Mayor, good, welcome. All the way from,
Oh, thank you.
all the way from the
I'm
diaspora.
actually in New York. Bronx, in New York. I'm not even at home. I'm on the road still, but I take a little time out. My friend's hosting me.
Yes, welcome, welcome. I think we should have Mikhail Phillips and other notable people joining us.
Yes.
But I'm really glad that you're here to share experiences.
Yeah.
Because we have to come together across the, it's not a political thing, it's really a national effort, and I would dare say national effort. So can we all just remind everyone to we have a few unmuted mics, but yes, it's good that we're here. I think we can wait a few more minutes. We're filling up nicely. We hope to have a very productive meeting tonight. We're gonna have, you've heard a lot about experiential learning from doctors, but we're also gonna have primary testimony from people who have experienced it. And so we're
I'll help you.
happy.
I'll help you.
Can we just remember to mute our mics? Let me just mute everyone. There you go. All right, mute everyone, and then we'll unmute.
Good afternoon, fellow Rotarians.
Good afternoon, welcome all Rotarians. We are hosting Rotary tonight, and also the Lions. We are hosting the Lions tonight, and we are so happy that you can join us on this platform in this national effort to share learning and understanding. So good afternoon, Sir Mike Fennell, Honorable Mike Fennell. So we have quite a mixed audience tonight. We'll have patients, families, loved ones, and we'll also have legislators as well as the media will be here tonight, as well as we'll have medical doctors and nurses present as well, both who are treating COVID and those who have had COVID, and both those who have treated and had COVID like myself. So we're just waiting. Shall we give another 2 minutes, Lorna, to kick off?
That's a very appetizing agenda.
It is. In fact,
Yeah.
I'm glad.
What's your timing like? Can you give an idea of your timing? Because when you start and how long it will last?
Well, I will tell you this. We're going to last until the last question is answered tonight, because people need to hear, have a perspective. We did a marathon, 5.5 hours. So feel free to, you know, to leave at a certain time. But most of the presentation should be finished by an hour. We're gonna go halfway into the presentations and then get testimonial.
Okay, great.
So I think by an hour, we should have had some content. Okay. All right. So
when do you officially start?
I say in another 1 minute, we'll officially start. Internet acted up a while ago. So in another 1 minute, I think we can get on the way, right? Is that right, Lorna? Let's admit all.
Is that a new minute or the same old minute?
Jamaican minute. How is that? To get brought up.
All right.
Sir, your recording stopped, so you have to start it again.
Thank you. Where is our record button? The record button just went. Is it that I'm no longer a host? No, I'm no longer a host. Can you make me a host, Lorna? Because I got kicked out. I'm no longer a host. You have to return.
Oh, I have to do that now?
Yeah,
Thank you.
return the privilege, because I'm not seeing where I'm a host anymore.
It's being recorded, and you are the host now.
All right, that's Penny. Okay, all right, great. Oh, thank you. Oh my God, thank you. It's right there, right here, isn't it? Yeah, thank you. Okay, so we have almost 400 in already. It's now 7 after 7. Is Pastor Mary Wildish here? You want to make sure?
Yes,
here?
I am. I'm here.
Thank you, Mary, because we can do nothing without God's guidance and great leadership and guidance and blessings. And these are difficult times. And it's fair to say that no one's alive who's seen anything like this. So I say the longer you live, you'll see everything, but I don't think that's quite the case, because this is in fact quite a different time. Okay, so I think we can get started. Is our co-host here, Dr. LEROY HAYMAN? Can we hear you, Dr. HAYMAN? Not here as yet. I think he has a massively busy day. I think we just have a very intense day of COVID cases. So doctors are going to be busy, probably coming in and out. But I would like to say that we can get the meeting officially started at 7:08. So Lorna, let's get started.
This is what the Prime Minister said, that them upset about.
Okay, we should also
something to the effect that they wouldn't get priority treatment if they got sick.
Okay, can we also just quickly recognize any members of the House of Parliament or any of our political leaders here? Can we recognize and just want to identify yourself so that we can recognize you?
Well, I am here, Donovan Mitchell, Mayor of Mandeville.
Very much so, indeed. The Lord Mayor, very nice to have you. It is indeed a pleasure, because you'll have several roles tonight. All right, so we'd like to get along at 7:09. We're officially started, and I'd like to just welcome everyone and thank you for taking the time to be here with us tonight as we share. We're not about teaching, we're about sharing our experiences. And from that, we hope to learn from each other and to get stronger, get better at coping, at dealing with this severe issue. Tonight, we have the Mayor of Mandeville, Lord Mayor of Worship, Mayor Donovan Mitchell, a very great friend of mine and a friend of a lot of people. And we're glad that you are able to make it, Mayor. So thank you so much for being here. And I'm sure you.
Thank you for inviting me and having me.
Indeed. We also would want to recognize the members of the clergy who are here as well in the audience. Welcome. We know that we need spiritual guidance, and your flock, they're looking up for you for guidance. So we thank you for taking the time to be here, and we just express our appreciation and our love for you. All right. So to get things started, we cannot start without God's grace and mercy and God's divine intervention. So Pastor Mary Wildish, can you bless this meeting? Thank you.
Yes, Dr. Hunt, it would be a privilege. And I just want to say thank you so much for what you are doing. As a pastor, we have many people right now in the church sick with COVID. They are following your protocols. And I am glad to say that to date, all is clear. They're all doing well. We only have one severe case out of about 30 odd cases. So Father, tonight, I thank you for Dr. Hunter. I thank you for this team of medical professionals. Father, we lift up the nation of Jamaica as members of the media here, Father, those that serve in the political arena. And Lord, we know that you are God of Jamaica. And Father, a nation that is in crisis with so many suffering. Lord, I commit this presentation into your hands, oh God. And Father, we thank you for solutions that will save the lives of our Jamaican people, Lord, and stop this horrific scourge on our island. So Lord, we commit and we ask your blessing over all that we'll present tonight. In Jesus' name, amen.
Amen. Amen. Thank you.
Amen.
Thank you. Thank you so much, Pastor Wildish. It's always wonderful and calm and warming and heartening to have your blessing tonight. In terms of our order, we may not be able to follow the exact order, but our first speaker is Dr. Sheridan Lee. Dr. Sheridan Lee is an amazing doctor. She's saving many lives. In fact, she's directly treating coronavirus at home, and she's using an amazing platform called iDoc. And we want to salute her, Dr. Jacqueline Chambers, for what they're doing, and all the doctors who are now fully engaging with COVID. So Dr. Sheridan Lee, are you here? Can we have you? Is Dr. Sheridan here? Not as yet. Okay. I see Dr. Germaine Spencer is about to join us. I think we'll have him. If Dr. Sheridan Lee is here, can you unmute yourself? already at 511. Dr. Sheridan Lee, are you here? No, not as yet. Okay.
Yes.
Are you here, Dr. Sheridan Lee? Okay, I'm going to mute everyone again. Okay, I'm going to mute everyone. Here.
And that is a commitment that has always been in place.
Mute all. Okay. Brother Germaine, Dr. Germaine Spencer.
Yes, I'm here. I'm here.
Thank you.
How are you doing?
Thank you, my brother. Good to have you. I'm glad you're here with us safely, having returned from your journey. We want you to enlighten us. We're going to ask you to take the first presentation. Can we all mute our mics as we come in? I'm going to mute all and have Dr. Germaine Spencer share with us, enlighten us. Dr. Germaine Spencer is a remarkable doctor. He's doing an amazing job in Montego Bay, bringing healthcare. He runs Bay West Hospital Medical Center and clinics, and is doing an amazing job in directly treating COVID. To my knowledge, he's the only private hospital in Jamaica that's directly treating COVID. And I apologize if that's wrong, but to the best of my knowledge, private hospitals have they've steered away from COVID. So Dr. Germaine, please welcome. Can you start us off, please?
Thank you. Thanks for having me, of course. I mean, this COVID journey has been a roller coaster ride. A lot of ups, a lot of downs, people dying, people recovering. I'm Germaine Spencer, Dr. Germaine Spencer. I represent Bay West Wellness Clinic and Hospital in Montego Bay. COVID has taught us a lot. I mean, it actually has questioned our faith at times and questioned medicine at times. But what I do know is that we have to do no harm and treat the patient that's in front of us. My journey in regards to COVID started long before the whole spikes everywhere, because we've been having, being in Montego Bay, we were exposed to patients off the cruise ship. And I think one of the first noted patients that was positive for COVID that eventually was airlifted out of our hospital to the States died. And that's when we found out that she really was COVID positive. So our staff at Bay West has been exposed long before it was that well known. And not only passenger, but crew members, sorry, not only passenger, yes, but crew members. We had also 2 suspected cases at the time that with high fever, shortness of breath, at the time that we just didn't know. And at that point in time, we were told to isolate the patient because we're not quite sure what it was. And at that time, we were managing with CPAP, trying to get the patient to get oxygen into the system, because we know there was some level of oxygen deprivation. Fast forward to now, we're literally in another situation where we have the locals and the far and great spread of this horrible disease into our local population, especially Western Jamaica, where I'm located. Now, what do I do? Based on literature, based on the mandate, we know that the issue with COVID-19 has to do with immunity and their ability to uphold and able to fight the virus itself, which is the coronavirus. I have been pushing a lot of pre-hospitalization care. I have also managed patients in the hospital setting, where we have set up a 10-bed facility that has in it ventilators, that has in it high-intensity, high-flow oxygen machines that literally pumps oxygen in the patient lung to allow their body to recover. The narrative of, and I guess worldwide, is to always to test and isolate, but the management that I've seen to work has to do with managing the patient now, not waiting until symptoms arise. Treat the patient early. If you have early signs, you test. if positive, you treat. And the cocktails is all over. And I'll leave that to Dr. Hunter to share the few cocktails that he has. But with my experience, especially personally, because I've contracted COVID myself, after using the medication ivermectin, and antibiotics such as azithromycin, the high dose vitamins, hydration, and rest, my recovery was quick within 24 hours. But not everybody's immune system will be as strong as mine. So we must encourage patients who have any form of symptoms of COVID, fever, upper respiratory tract symptoms like runny nose, coughing, body aches, dengue, because my symptoms was dengue-like, body aches, joint pains. Test. Do not have any hesitation to test. Almost everywhere in Jamaica, you can find a testing site to test. And the idea is early testing and early treatment. That should be the narrative. You have it, you treat very early. It's not only stand on your yard and wait. It's stand on your yard and treat. Treat, rest and hydration. I honestly believe that if we take that approach and we say to everybody until the vaccine kicks in, because we have a mass vaccination process happening now, which I must commend the government for doing what they can. But until then, where immunity sets in, what do we do now? And I've been saying this from now. What do we do now? We have patients who have it now. What do we do now? And what do we do now is to treat early. Treat early. The data is there. The local data is there. Despite they're not pushing it, it is there. We are seeing a tremendous turnaround, a remarkable turnaround with patients. And it's not only in those with mild symptoms, but with also moderate symptoms, with also severe symptoms. I have a young man downstairs now in my hospital. He is in his 30s. He had severe COVID. He was on the high flow machine. He was on the, literally, I just looked at him. He's on a nasal cannula. He's eating. Remarkable turnaround. So with proper management and proper care, these patients will have a high turnaround. Yes, we know that this disease affects the vulnerable patient. We know that. But what we want to do is to give the vulnerable a chance. We need to give the vulnerable a chance and treat them now. That is the message they need to send across. It's not a death sentence. And there's a lot of people with anxiety. They're so anxious, they're nervous. Everywhere you can feel the tension. Let us spread the message that early treatment works. And that is what I want the take-home message to be. Thank you very much.
Thank you, Germaine. That's a very powerful message. What is wonderful about Germaine is that he actually skirts the early treatment spectrum, but he also has the critical care and ICU. And so he's best positioned to balance critical care treatment versus early treatment at home. And his conclusion is what we have all been saying, that early treatment at home works. We welcome others to come in and to understand that early treatment is one of the foundations of medicine. And we welcome all to this tent. It's not about I told you so, anything like that. We need everyone to be on board on this early treatment message. And Germaine, can you just roughly just tell us a quick figure in terms of early treatment at home versus 2 or 3 weeks in a critical care environment? What's the difference in cost? Not to mention the emotional, the intangible costs. Can you just quickly tell us?
The reality is that early treatment costs, I mean, right now we are trying to drive down.
Yes, can you hear me now?
Right now we're trying to drive down the cost for ivermectin. We're trying to drive down the costs for anything that can support a patient from recovering. In reality though, in reality, for a treatment cycle, we're looking at about 10 to 15,000 Jamaican dollars for a patient for pre-hospitalization care. That is before they're being admitted. Hospital care, however, is very expensive. There's no two-way of put it anyway. And I think with a health infrastructure that has been having its issues, putting it very mildly, for years, I mean, I'm not blaming this government, it's successive government after government. Our infrastructure, health infrastructure, is bursting at its seams. And I can tell you this, to manage a patient privately is hundreds of thousands of dollars, hundreds of thousands of dollars. If we need to give them care that is appropriate and of first world in caliber, to give them all the intravenous medication and oral medication to support them, to have one-on-one ICU trained nurses, to have physiotherapy on board, to have parenteral or IV nutritional support, we're looking at a lot of money. And it's no joke. It's no joke. It costs to save their lives. I'm not even going to pretty it up. It is very expensive, hospitalization care. However, in comparison to pre-hospitalization care, it is totally different. It's far, far cheaper. Now, we have to lobby the necessary powers that be to see how we can get the average Jamaican to be able to access this, because of course already they're unable to earn because of the economy, the lockdown. What do we do? And we need to lobby support groups, foundations, the government as well, to have all the necessary pre-hospitalization care, or I'll put it the combo package, or the cocktail of medication available to every Jamaica, in every strata, in every parish, in every area. It can work. So the same health structure that is already in place, where you have community health aides, nurses that visit residents, we may need to go back to the old school type medicine to get this thing going and get this thing working. But we need Jamaicans to be disciplined. We need Jamaicans to be disciplined. We need Jamaicans to understand that they must be not only responsible for their health, but be responsible for their neighbors and their other family members' health, the vulnerable health. So they need to test whenever they have any symptom that may suggest that it could be COVID, and treat and isolate. Retest to ensure that it's negative before they go back to the public, because isolation and testing is still part of it. It's still part of the care, and it is public health 101. It is what it's supposed to be because of how contagious this disease is. So that is basically it in a nutshell. Yeah?
Thank you, Germaine. Again, always enlightening, always refreshing to hear your summation of the situation. Is Dr. Sheridan Lee here as yet? Can you unmute yourself? No. Dr. Sheridan Lee? No. Okay. Do we have Dr. HAYMAN? Is LEROY here? No. There's so many people, it's hard to keep up. Is Dr. Michael James here as yet? No. Okay. All right. Do we have Dr. Andrew Phillips? Dr. Andrew Phillips, can you unmute yourself if you're here?
Yes, I'm here.
All right. Thank you. Andrew Phillips is very much, in our estimation, a key figure in terms of helping us to overcome the this whole scourge that's afflicted not just Jamaica, the entire world. Oral hygiene is absolutely crucial, not just to COVID, but also to our general health. So without saying much further, I'd like to welcome Dr. Andrew Phillips for his presentation. Thank you, Andrew. Go ahead.
Thank you very much, Dr. Hunter, for the invitation to be here. Let me just ensure that my screen.
Yes,
you're seeing my presentation, yes, sir?
Very well, very well. Thank you. Yeah.
Okay. All right, you're right. So I was saying, thank you very much for having me here. I am very appreciative of the decision to include us in this venture as we all seek to work together to put an end to the scourge, as the pastor said earlier. And we understand we're strapped for time, so I'll get straight into it. We're looking specifically at oral health, and I want to share some information quickly to help us understand that our oral health really is the gateway to the body. Now, dentistry as a whole is something that is very, very undervalued in our country. The dentist is often used as a story of with Red Riding Hood and the werewolf and whatever it is in an effort to scare children into proper behavior. There are many children who grew up with the threat of if you don't behave, are taking you to the dentist for him to pull out your teeth. As such, this has helped shape the country into the belief that the dentist is nothing more than a butcher, and one that is set up in institutions to do nothing other than to pull teeth. This has contributed to the negative outlook in society, also the belittling of the profession in some ways. We're here to help look now at what exactly is oral health. And again, I'm going to just take the time to thank Dr. Hunter. So what is good oral health? The World Health Organization puts it that oral health is being in a state, being free from mouth and facial pain, oral and throat cancer, oral infection and sores, periodontal disease, tooth decay, tooth loss, and other diseases and disorders that limit an individual's capacity in biting, chewing, smiling, and speaking. Overall, their psychosocial well-being. Now that sounds like a lot, and it might be a lot to process, but essentially, good oral health is ensuring that you're able to function and that your oral cavity itself is not in any state of damage. I have a picture of oral cavity here. I don't know why it's not loading, but we press on. The oral cavity is not only the teeth. The oral cavity includes everything in the mouth, including the anterior 2/3 of the tongue. So don't go all the way back there, right? But we look at the cheeks, we look at under the tongue, we look at the roof of the mouth. These are components of the oral cavity. Oh, there it is. These are components of the oral cavity. So now when we start thinking, immediately our viewpoint changes. When you start thinking, I have good oral health, it's not merely to say that my teeth look good. It's not yes, it's not merely to say that I can smile, I can talk. It is more that suggests you have good oral health, which is one of the problems that we have in society because we don't recognize when our health is poor. What does this mean? My health can be poor because of my constant mouth ulcers that keep coming up for various reasons. We have smoking habits. We have habits of placing items in our mouth that really shouldn't be in our mouth. We have persons who wear dentures who keep in the dentures longer than they should. For example, most patients who wear dentures don't know that they shouldn't sleep in it. And that's a story for another day. But all of these things contribute to having good oral health. Now, the simple thing about having good oral health, what does it help you to do? It helps you to eat, to function, which is the main thing. You ask anybody in prep school or primary school, and you ask them, what is key for good oral health? And they'll probably tell you something about eating. Phonetics, though, the ability to talk, the ability to speak is oftentimes ignored. I would invite you, wherever you are, to just do a quick check of something. I want you to say a couple words with me. Don't unmute your mic, but I just want you to say it where you are. I want you to say 55. 55. Now, having said that, if everything is okay as it should be, you should have felt your teeth touching your lip. That is a relationship that helps to give you what we call a fricative sound, the F sounds. Now, I want you to quickly say 66.
66.
That S sound, that hissing sounds only comes about because you have proper alignment of your teeth, giving you 1 to 2 millimeter space between your top teeth and your bottom teeth. If you had no teeth, you couldn't pronounce certain words properly. A habit of sucking your finger, for example, you wouldn't be able to say certain words properly because your occlusion would be off. That is important for self-esteem. That is important for good oral health. Moving along quickly. Facial support is also important. We want to be able, as we age, a lot of persons see that your face
You're
starts
supposed to
sink
read the story, Saju.
because
Don't do this to me today. Don't do this now.
Right. A lot of persons seem to think that it's because you're getting older that things happen, like your face sinking in or your face starting to look longer. That's not the case. It is actually the loss of the facial support from the structures in the mouth. Loss of certain teeth, loss of teeth in particular areas contributes to this loss of bone structure, which causes the face to then have the appearance of sinking in. As persons get older, you can look at somebody, for instance, and you're able to tell what teeth they're missing just by how their lips meet. It's something called the vertical dimension of occlusion. Again, story for another day. Now, let's get more into what we're speaking of here this evening in terms of looking at the oral health being a general part of our health overall. First thing to recognize is that the mouth is not a sterile environment. There are over 700 types of microbes that exist in the mouth. Limited to bacteria only. We have bacteria, we have fungi, we have viruses. All sorts of things exist in the mouth. Now, I'm saying this, I want you to start to tangibly think of just how many things this could be. By the time I'm done, certain things shouldn't be in practice anymore for the 800 participants here. No one should ever consider sharing a toothbrush with somebody else, for example. Right? Starts to sound a little bad now. Now, poor oral health can lead to increased bacterial and viral loads in the oral cavity based on what your particular is or based on what condition you are having. So I was having a conversation with Dr. and I was talking to him about our mothers. Or pregnant mothers, for example, have shifts in the hormones which contribute to a bacterial change in the mouth. Now, depending on how they take care of their oral health, they can get gingivitis that goes very, very bad, very, very fast. They can end up with something called a pyogenic granuloma, which is just a little tumor. That's an extra outgrowth of tissue that bleeds bleeds a lot. This is just simply because of poor oral health combined with the hormonal shift. You wear dentures, as I mentioned. Certain microbes live more on the denture. So you keep it in your mouth too long, the microbes grow there more than they would be in your oral cavity normally. And they don't get flushed off. That causes you to have a rash because of the presence of the microbes. Lots of things can happen. Now, scientifically, there's a lot of things that we can identify that happens between oral health and general health. We have relationships with cardiovascular disease. We have relationship with diabetes. We have relationship with premature birth. We have relationships with low birth weight, cancer, and all manner of autoimmune diseases. If it were not a session, we could go further into it, but I can tell you about some inflammatory mediators that exist in the body, amongst other things. One of them, the notable ones, being prostaglandin. And that comes up with damage to tissue. Now think about this mouth in the picture, right? You can understand that this mouth will be somebody who's having a lot of disease. Let's, however, jump down. Let's, however, jump down to looking at its relationship to COVID, because I know that my time is short. In the mouth, you have ACE2 receptors in the tongue. ACE2 receptors, for those who are not heavily scientific or science-based, they are angiotensin converting enzyme receptors. These receptors are receptors that bind the SARS-CoV-2 virus. If we're thinking about it in a practical way, if you know what Lego blocks are, although Lego blocks might not be the best, maybe a puzzle, a picture puzzle, because they can fit into specific places. And so the receptors on these epithelial cells serve as the binding areas for the virus before the virus tries to make its way into the cell. The tongue has a lot of these receptors on it, which is one of the reasons why studies have shown that with the increase of the SARS-CoV-2, we're recognizing that there's a presence of the virus in saliva. It's a heavy presence of it in saliva. No.
Right. I'm going to.
COVID-19 is related to several family of viruses that we would have met before, such as SARS and such as MERS.
That's all.
As we mentioned, because of its potential to bind to these ACE2 receptors, it contributes directly to this COVID-19 being more contagious than some of the other viruses. We have viral infection. Some of the ways that it shows up in the oral cavity can be in the form of loss of taste, dry mouth, rashes that we mentioned, or mouth ulcers. Now, some research has been done since COVID-19 has become prevalent. Two pieces of information I took to share with us. A study was done in 2020 in Hong Kong. and it recognized, in the study, it recognized the presence of the SARS-CoV-2 virus in the saliva. What their study was focusing on, is to look at the particular time of day that the viral load is highest in saliva. In their study, they actually found that 8 out of the 13 subjects had a higher viral load in the early morning than throughout the other time points of the day, which would have been before lunch, before tea time, before dinner, and before bedtime. Now that's interesting, but it's not really interesting for us as dentists. If you have heard any dentist talk to you, one of the main things they'll say to you is brush your teeth before when? Before bed. The reason for this is simple. There is not as much salivary action and salivary flow during the night while you sleep. It's not happening. So during the day, while you're functioning, while you're talking, the saliva is helping to keep the area moist. You're swallowing saliva, you're eating, you're drinking, but in the night, you are not doing this. So you don't have that buffering action of the saliva that it offers. You also don't have an increase in the production of the salivary immunoglobulins or anything like that. Whatever is there is pretty much there, with minor secretions that happen during the night. So the viral load can tend to be heavy based on this study here. Now, I heard mentioned by the previous doctor, forgive me for not remembering his name, we mentioned about home care. If you are at home, one of the things you would want to note is the ability to ensure that you try to clean your mouth first thing in the morning. I'll get to what you can clean your mouth with a little later. But in general, not only in the space of COVID-19, but in general, your dentist wants you to ensure that you keep your mouth clean. All right. Another journal, another research proposal, another research that was carried out was done, and it is in the International Journal of Oral Science, volume 12, article number 8. It can be looked up, just like the other one. And this one looked at the fact that the ACE2 expressions were more prominent on the tongue than other epithelial cells of the oral cavity. From their study, they also recognized and proposed that the oral cavity can be regarded as a potentially high risk site for infectious susceptibility because of these receptors being present on the tongue. Now, what can we do about it? Specifically to COVID, I'll get to general cleaning in a bit. There are several discussions about what can be used to help clean the oral cavity to help limit and lower the viral load. One item that has been proposed is 1% hydrogen peroxide. Now, as we have learned at the beginning of COVID, many things are continually changing as more research is done. At this moment, I have found not enough information to bring with me to share with you to suggest that 1% hydrogen peroxide on its own does enough to destroy or to limit the viral load present in the oral cavity. There are some studies that suggest that it can be done, but there's nothing concrete. Hydrogen peroxide can destroy many cells. It can destroy bacteria, it can destroy funguses, but its action on viruses has not been shown to be as strong as specifically this virus right now. However, studies have shown that there may be some hope for chlorhexidine mouth rinse to be used. Chlorhexidine is, if I'm not mistaken, available over the counter. If I'm not mistaken. Somebody can check on that and tell Dr. Hunter in the future, just in case. But chlorhexidine being available can be used. And the strength that was used in the Lancet study in April 2020 was a strength of 0.05%. What is commercially available over the counter is a strength of 0.12%, which is sufficiently over what is suggested in the study. And this mouth rinse would be used for 1 to 2 minutes, sometimes twice a day. It helps with viral load, bacterial load, and such. We tend to use it mainly in our patients with periodontal disease. When we're treating gum disease, we want to help get the bacterial load down in the mouth. In general, though, in closing, when we're looking at disease prevention measures in oral health, for oral health, we're looking at ensuring that we brush our teeth at least, most persons say 2 times a day. That's what I heard, at least 2 times a day. The truth is we want you to brush after every meal. Think about yourself being in fresh white clothes and just run out into the mud. If you came in and bathed off yourself clean, put on fresh white clothes, like end up out in the mud afterwards, would you come back inside and go to sleep and say, I bathed 1 time today already? No, you wouldn't do it. because the bath prior wouldn't suffice for the fact that you're dirty now. Treat your teeth like that. After you eat, your teeth get dirty, your mouth is dirty. You should ideally brush after each meal, ideally for 2 minutes with a soft toothbrush. You should change your toothbrush at minimum every 3 months. At minimum every 3 months. The texture is soft. Remember I said, don't use hard. A lot of persons like to use a hard toothbrush because it can last long, and they use it until it's spread out like it's spraying, right? Don't do that. You change your toothbrush every 3 months. One of the benefits of changing your toothbrush every 3 months, remember I spoke to the fact that there are over 700 species of microbes. All of those microbes get on your toothbrush. Your toothbrush stays wet at minimum twice a day. Those are conditions perfect for bacterial growth. Your toothbrush will keep bacteria present. So if you recover from illness, you need to change your toothbrush because whatever particles would have been present in your mouth are also present on your toothbrush. So for those with COVID, as soon as there's recovery, get rid of that toothbrush. All right, you want to get rid of the source of anything. We're looking at flossing. We want you to brush your tongue as well. Use antiseptic mouthwash. We spoke to the chlorhexidine a while ago. Oh, by the way, I'm just hastening to say, chlorhexidine should not be used for more than 2 weeks. It will stay in your teeth. All right, no more than 2 weeks at a time. We also want to advise you that you visit your dentist at least twice a year. There are several things that are of benefit when you visit your dentist. We do extraoral and intraoral examinations that are not limited to your teeth, all right? And with this, we are looking towards everyone putting in place all of these disease prevention measures so that we will have good oral health. I thank you.
Thank you, Andrew. This is just an amazing presentation. I hope a lot of minds and eyes and hearts have been opened. It's just as a neurosurgeon, you know, one of the things I learned early is just how important the teeth is, you know, and not just the teeth, but good oral health. Indeed, and indeed. I'm telling you, many times I've had to be operating on the brain because of the teeth.
Mm-hmm. Oh yes. If I had time, I could go into that, man.
Let us just quickly say, and just for people wondering, can a bad tooth cause a heart attack or a stroke?
Yes, definitely. So the studies do suggest this, and there's a simple reason for it. We spoke to the fact that we have microbes present in the oral cavity. There's something called a bacteremia. First, let's go that route.
Blood poisoning.
Enough damage in the oral cavity and the mouth itself is not in a good state. You have a proliferation of microbes. They can transiently get into that bloodstream and flow around all over the place. And as you know, that is going to cause severe problems down the line for other things. There's a relationship also between particular types of bacteria and diabetes. Now, this relationship is a two-way street. And most persons who have poorly controlled diabetes have poorly controlled periodontal disease. Those who have poorly controlled period disease have diabetes. It is there, right? We have also shown that in relationship to things like preterm birth weight, as we mentioned, with prostaglandin becoming present, excessively of the damage to the tissues, it can have all sorts of things happening with the body because that is being secreted. So if the inflammation exists here, you have cardiovascular diseases that come along because of your poor oral health. You can end up with things like stroke, you end up with heart attack. I mean, there's so many things that can go wrong because the gateway is bad.
Have you, you know, I've had to, in the middle of the night, these things normally happen. I've had to operate on several brain abscesses, pus inside the brain, just because of a rotten tooth. It's certainly something not to sneeze on, and sadly people have died from that. But in terms of the COVID, yes, go ahead.
If sorry to cut you on that, but I couldn't pass up without saying, persons don't recognize the importance of looking after teeth that are decayed. And so oftentimes it's a joke.
Okay.
You end up with something called cavernous sinus thrombosis, or you can end up with something called Ludwig's angina. No, those are different sides of the jaw based on where that infection is. But the Ludwig's angina, for those who are listening, is a bacterial infection that can spread from one of your posterior teeth at the bottom and get into the spaces of your neck.
Okay.
And if you fill this space and go across midline, block off the area, a problem. For the cavernous sinus thrombosis, as you were mentioning, that one is going on.
And a brain abscess, that's a frank abscess in the just pus, like condensed milk and blood. But the reason why we're mentioning that is for people to understand also that coronavirus does directly cause damage but a significant amount of the times it's the bacteria that's doing the damage. They're falling behind the virus. And so that virus causes the inflammation and the bacteria just walks in. And it's interesting because during the Spanish flu, what really killed people was the secondary bacterial pneumonia. And we're seeing a lot of lung pathology here. And we know that the bacteria in your mouth is also linked with that. So I want to thank you so much for that excellent presentation. I've been emphasizing Listerine a lot. I mean, for me, I can't sleep. I'll never get a good night's rest unless if
you don't use it.
or my teeth are not brushed. And I literally walk around with Listerine instead of hand sanitizer. I walk around because my head hurts me when I don't have it. So I want to thank you. But is Listerine safe? Can you use it 3 times a day?
All right, Listerine is safe. As for the amount of times to be used per day, it depends on the particular brand. So it's very important for us. If it's one thing I learned from COVID is that most persons don't read the directions of the things they're using, which is why we end up with persons spraying Lysol over their clothes while they're wearing it, if you understand what I'm saying.
Absolutely.
The purple Listerine, which is one that is high in fluoride content, if I'm not mistaken, that one is once per day because you don't want to have so much exposure to the fluoride. Once a day is good enough. There are some others that you can use 2 and 3 times a day based on the need.
Just to say quickly, because time is against us, but just to focus our minds a little bit in terms of COVID. I mean, from last year early, we had studies that showed just how quickly does coronavirus dies when it's directly in contact with mouthwash, and not any particular with mouthwash. How quickly does it die?
Okay, so I haven't seen the studies as yet, so I'm not sure of the time frame that it can.
I've been
checking to see.
Yeah, I've been checking it very clearly, and it's for 30 to 40 seconds. It kills the virus. Hand sanitizer, alcohol kills the virus in seconds as well. So the action of the Listerine or the mouthwash kills the virus, definitely undisputed in the lab. It's shown. So you really should be aiming for at least 60 seconds of mouthwash as well.
Right. So it's 60 to 2 minutes.
Right. 1 to 2 minutes.
That we use. Right. 60 seconds. Right. 1 minute to 2 minutes.
Lovely, lovely, lovely. Okay, thank you so much. We have to move on. We want to hear a lot more. We'll bring you back again. And please stay with us.
If I could say one thing though, that I think that's a hand from a P along there. I just wanted to find out if that's
you want to ask a question
in biology.
Okay.
Right.
All right.
But
okay.
I thank you for having me, Doc, and all the best. I'll be here for the rest of the presentations.
Lovely. So we're going to have questions at the end. So we don't want to interrupt the flow because you're running a little behind. I think at this point, what I want to do is to bring in Mayor Donovan Mitchell, the Lord Mayor of Mandeville, a good friend of many. And we want to hear from him because you've heard a lot from the clinicians and the doctors and the dentists. Let's hear from Mayor Mitchell. So let's welcome Mayor Mitchell. Can we have you contribute your COVID journey, your personal and the extended experience you've had? So Donovan, can you let me see if I need to unmute you. Yes, can you unmute yourself? And let's have you at this time. Mayor Mitchell. He might have stepped away. All right. So as not to lose any more time, is Dr. Sheridan Lee here in the house? Dr. Sheridan Lee, can you just unmute yourself and let's have your presentation? Dr. Sheridan Lee, Sheridan, can you unmute yourself? No? It's Mayor Mitchell here. So, Sheridan, can you unmute yourself? Okay, is Dr. and let me just mute everyone and see if I can get people to unmute themselves. All right, let's just mute all. Okay, Dr. Yes, I unmute all. Okay. Dr. Lee, can you hear us?
Doc, just very quickly, click the name of the person you want to unmute and unmute them.
Okay, that's a good. Thank you, my counsel.
Because you have unmuted everybody, so we're going to hear.
So it's gonna be chaos. Dr. Lee, you're unmuted. Can you go ahead? She's sending me a message to say that she can't unmute herself.
Doc, you need to mute everybody again. You have unmuted everybody.
Yeah, just to try to get her in. Right. Sheridan? Okay. All right, let's go again. Sheridan, can we have you unmute yourself? Okay, no, it's Mayor Mitchell back with us. All right, we're gonna move on. We're gonna make a pause here.
Doc, she's unable to unmute herself.
Sorry, Mayor Mitchell, can you go ahead? Sheridan, are you here? Are you here? No. Unmute themselves? No.
I'm now on mute.
All right, thank you. Sorry. Yes, go ahead. I'll be better next time. Go ahead, please. Let's go right in. Can we ask everybody else to mute themselves? Thank you. Go ahead.
Hi, good night, everyone. I am joined tonight with my presentation with my little one. Unfortunately, I don't have a nanny tonight. I am Dr. Sheridan Lee. I am Managing Director for IDOC Concierge Wellness Services Limited. And I want to give my journey in terms of early treatment of COVID-19. No, I finished work about after 6 this evening, having seen and tested over 100 patients today, many of whom are positive. Now, the importance of early treatment for me, what I found is that a lot of my patients, they come and they have been to the clinic or even to the hospital, and they would have gotten tested at the clinics roughly 5 days before, even a week, and still awaiting a test result. Or they would have gone to the hospital and they would have been sent away to get tested at the clinic. So even when they get a test result from the clinic, what a lot of persons are saying is that they're not given any real guidelines as to what to follow. Now, once a person says that they have COVID or know that they are COVID positive, they want to know something. They want some amount of guidance, even if it's to say to them, go home and, as Dr. Hunter says, mouth care, breathing exercises, go out in the fresh air. Persons want to know that there's something they can do. Most persons do not want to hear to just go home and stay in. Now, in our company, what we have done is come up with some guidelines. We have actually put that on paper, and all positive patients are given a printout of these guidelines and a contact number to contact us if they have, just for monitoring, and if they have any new changes that other than what they have come to our clinic with. Now, for me, in terms of early treatment, I know there's no clear-cut guidelines or anything that has been given to us from WHO or CDC that this drug is recommended for treatment. But for me, is what is the harm that we can really do? Even in terms of ivermectin, I mean, there's clinical trials that are ongoing for the use of ivermectin. They have not, WHO has not said do not use. It has said that you can use once you are using in a trial. And I think us doctors, all of us doctors who have come together and who are doing early treatment, we're not just leaving the patients and saying, oh, go and take ivermectin, and we don't business with you after that. We're actually following up these patients and we're documenting the findings in terms of side effects and their outcomes so that we can put this together in a literature to say whether it works or not. So yes, Jamaica is doing its own research into how early treatment works. And I just don't think it's enough for us to tell patients to go home and watch. Where with the Delta virus, we're finding that more persons are getting early pneumonia, and it's not going to take necessarily a week or 14 days for them to develop this. Persons are getting this very early. So whatever we can do as private physicians or even public physicians, even if it's to tell somebody that, hey, you know, go and do a menthol inhalation, take a cough medicine, you know, have your oxygen saturation, monitor your oxygen sat, watch out for signs of respiratory lung involvement, such as early signs of shortness of breath. And the earlier you catch these signs that you might be leading to more detrimental or serious COVID-19, then the quicker you can act. And I think that's what we've been lobbying for. We're not anti-vaxxers. I am vaccinated, and I know a lot of other doctors in this forum are all vaccinated. We're not saying that we're not saying do not go and take the vaccine. What we're saying is, yes, we should take the vaccine, but there are a lot of persons who are actually presently infected with the virus and they cannot be vaccinated. What we are saying is concomitant care, vaccination, early treatment, and safety measures. So I am vaccinated and I still wear a mask because I can still transmit the disease to other persons. So not because I'm vaccinated, that means my duty is only to me. It's also to other persons. I actually met a family today who the daughter was actually vaccinated. Her mother was not vaccinated, and she got COVID-19 and she transmitted it to her, and her mother got it as well. So even if we're vaccinated, it's very important that we be mindful that we can also transmit COVID-19. Her mother was not vaccinated.
Thank you, Dr. Lee.
Vaccinated is a very important.
Pardon me a second, we're having a little bit of background.
Her mother was not vaccinated.
Thank you, Dr. Lee. Pardon me a second, we're having a little bit of background. Okay, thank you, Dr. Lee. And just to come back to you, Sheridan, how important again is we need to set up studies and we need to identify local learning, but how important is it to also, as we go along, to audit our own findings and to see what works and what doesn't? Are you seeing a lot of people dying from early home-based treatment, or are you seeing people thriving at home and doing well? Just one.
Well, I have not had any of my patients dying from early treatment. I have not had any persons going into severe COVID-19 or anybody dying. So that has been my findings.
Thank you. So again, we thank Dr. Lee for being an awesome supermom. You can see what she's balancing our lives and balancing her life as with her loved one. So thank you, Dr. Lee, for sharing and enhancing our local experience. Now, is Mayor Mitchell back with us now? Donovan, can you unmute yourself?
Host, I think you need to mute everyone, and you need to control who is being unmuted and who is.
Lorna, are you Lorna? Lorna, can you work that?
Host, I think you need to mute everyone.
Or I'll do that now. Unmute all, and I'm going to unmute everyone. Lorna, are you? Okay. Is Mayor Mitchell with us? Has he returned?
You also need to mute.
I'm trying, but I'm sort of in the middle of something else.
All right, no problem. I'm just gonna mute. I'll just control it. I think we're
Mute the
exceeded
live stream as well.
our maximum.
Dr. Hunter?
Yes.
Hi, yeah.
I'm trying, but I'm sort of in the middle of something else.
Okay, I'll fix it. So again, apologies. Just give us a little bit, everyone. We're gonna stop the live stream because the live stream is causing some feedback. Sorry, I'm gonna have to stop the live stream.
Don't have to stop it. You can mute it, Doc.
All right, so you can mute the live stream. Okay, so I'll mute it here. All right, that's good. Thank you. All right, thank you. We are all about learning. This is about shared experiences. All right.
Can I make a suggestion, please? You maybe need to make someone else co-host. So
Yeah, I think, yeah. Can we have a hand up for who would like?
Williams is willing to assist you with the.
Williams, let me find you.
Danny and Malcolm, you here? Hi.
Dr. Patient's hand is up.
A co-host. All right, just a minute. Faithlin, you're now co-host. Can you just help us as we try to go through? Now, we're not taking the question and answers right now. So if it's a technical question, we'll take it. But if it's a content question, we're going to leave that at the end. Just trying to see if Mia Mitchell has come back. If not, we'll just move right along into the next presenter is well, we'll take at this point in time actually and just do a experiential learning. So is Roxanne silent here? Can we have Roxanne? Can you unmute yourself and just share your COVID journey? No? Okay. Okay, can you share? Roxanne, are you with us? Okay. Miss Silent? Okay. Is Miss Nervelin Crooks here? Okay. We're not quite ready. Can we get Miss Crooks? No? I think we have exceeded the 1,000 capacity, so people might be coming in and coming out. Okay, at this time, I'll just go into my presentation because I'm mindful of the time. It's now just after 8. So I'll do my presentation at this time, and then we'll get people the testimonials at the end. Okay, and hope that Mayor Mitchell will join us then. So I'm going to start sharing my screen. Okay, can everybody see that? Okay, give me a second. Well, okay, all right. Can we all see this? Beautiful.
Yes, Doc, we're seeing.
Lovely, thank you. Can we all mute ourselves? Okay. Okay. All right. Good evening, everyone. So for those who are seeing this for the first time, we've developed experiential learning, and we're going to do a simple local algorithm for the experiential learning of the COVID journey. Certainly, we've had COVID with us comfortably now for 1.5 years. This year, of course, we've had more experience from COVID. I am Dr. Roger Hunter. I'm a consultant neurosurgeon and spinal surgeon, as well as the MAJ President-elect nominee for 2021. We like to just spend a few minutes also to recognize the disaster that's happened in Haiti. And we have set up a fund that people at First Global Bank that you can donate, and the funds will be handed over to the MAJ charity. And we can show this at the end, but we need to recognize also that in a few moments, more people have died in Haiti than all that have died past from coronavirus in Haiti and in Jamaica combined. Now, the current scenario in terms of healthcare, it's all institutionalized. Healthcare services are heavily focused and centered around whether government, in terms of the government services, they're heavily centered around hospital or clinics. Not much in terms of domiciliary services. Our positivity rate now with coronavirus is 46, practically 50%. And pretty much all patients even had pretty much oxygen delivered, not necessarily at their home through the government services, but in a government hospital. And I recently had with Hurricane Grace, the unfortunate situation of patients in a tent actually experiencing the force of Hurricane Grace whilst they were receiving oxygen. All measures have failed. Over $10 billion have been spent trying to isolate coronavirus, and yet we have not been able to do so. Now coronavirus is community spread. Cornwall Regional Hospital continues to be a problem and is begging to be repaired. 6 years is a very long time. So we need to fix Cornwall Regional as soon as possible, because coronavirus, yes, is a killer, but there are other deaths, and it's certainly not in our top 3 killers. Stroke, cancer, and heart attack still our biggest killers. So hospital is now saturated. We're hearing 160%, and we're hearing from the chairman of Western Regional Health Authority, Mr. Clark, appealing for help from government hospitals. Certainly in my experience last year, United Kingdom government reached out to doctors everywhere in the world, including myself, to come and help them. But we welcome this appeal from Western Regional Chair, but we'd like to hear it also from the central authorities, particularly from the Prime Minister and certainly from the Minister of Health, to see how it can resonate. But the lack of equipment is dire, and it helps to, unfortunately, it doesn't help in terms of getting good outcome. Staff morale is at an all-time low. We recently had a very unfortunate and the tragic situation of imprisonment, although temporary, of doctors behind bars. We need to recognize that in a pandemic, certain protocols need to be suspended. And one of them is how you treat with patients who are not, people who are not criminal, who are not violent offenders, and how we treat with them that way. We see the courts themselves having to shut because of the pandemic. And certainly we are very disturbed by the imprisonment of doctors recently, however short, for things that are certainly not of a violent nature. And we make this forum appealing for government to restore those doctors to a sense of dignity and reverse that penalty that was unfairly applied to them. Now, and we don't want any more short contracts within the health sector. We have doctors recently being released after 6 months contract, and then guess what? We have a massive surge in coronavirus, only for the Minister of Health to now be appealing to said doctors to come back to work and canceling leave. This shows some failure to understand the health system in a very decent and regular manner. It's quite puzzling that contracts could be stopped and then you're back again. Nosocomial infections do arise from hospitalized care as against community acquired, which is what you get in the community. Generally speaking, infections that you pick up in the hospital are harder to treat than infections that you pick up in the community. And of course, we also recognize iatrogenic injury, as happened with Jody and Ferron. And we are therefore then mindful of the risk of concentrated institutionalized care for things that can be treated at home. But what we recognize in our algorithm that we've developed is that all homes must have a pulse oximeter. This is a recommendation that we mentioned last year to the central authorities, that all homes must have a pulse oximeter. It was met with lukewarm reception. Now we're seeing most people not waiting for the Ministry of Health to say it. They're going on their own and getting a pulse oximeter, because with a pulse oximeter, we can tell you where your oxygen levels are at, who is perhaps very nervous and hysterical, and who has an oxygen level of 99%. Oxygen levels should normally be between 95 and 100%. If you're 95 to 100%, you can easily just use simple measures and not necessarily panic or head to the hospital. So the pulse oximeter is actually essential, and we welcome WHO that has recently joined the conversation of recommending pulse oximetry routinely. Infrared thermometer is also important, but we also know that with coronavirus, only about half of these patients have a temperature. It's not 100%. So we recognize that as very, very important, that we do have a thermometer, but at the same time, only half will have a infrared, will have a temperature. All homes must have a glucometer, especially if you're diabetic. And we recommend this back to the government in 2020. All doctors need to report for duty. All doctors must be COVID champions. All doctors, we don't want COVID marshals. We don't want to imprison doctors. We want them to be real champions, to go out there and to save. Right, it is happening as we speak. Most COVID cases are being treated in the independent public health private pathway. They are being treated by independent private practitioners. And so we're really having COVID champions and COVID marshals. COVID marshals is not what we're advocating. but COVID champions and COVID competence. All doctors must have a COVID competence. The new way, most COVID cases, again, are treated by independent public health practitioners, and home-based monitoring with pulse oximetry, infrared thermometer is very, very important. Early treatment is absolutely crucial. Dr. HAYMAN, several doctors, Dr. James will tell you that you need to treat early, ideally less than 7 days. By doing this, we are really avoiding the terrible complications that you tend to get after 7 days have passed, such as blood clotting in the lung. Home-based treatment works. By now, I've treated over 200 cases, no longer 110. The oldest, yes, still remains 104 years old, and she's alive, a retired nurse from New York. We have been able to apply our steadfast treatment of early home-based care to patients who are not only mild and moderate, but in some cases significantly ill, and they have all been able to survive. We recognize that every home, therefore, in Jamaica must have a pulse oximeter, they must have an infrared thermometer, they must have a glucometer if they're diabetic, and a digital blood pressure machine. It is quite easy to read your pulse oximeter. Your SpO2 should be between 95 and 100, but between 90 and 100, that's acceptable. The temperature, you normally want to see a temperature range between 36 and 37.2 degrees Celsius. 37.4 and higher, bit worrying. Less than 36, you really need to be warmed up. Internet connectivity is important for this model to work, the home-based treatment. Every home must have some access to internet connectivity, whether by WhatsApp. My number is there. You must be able to get access to your doctor. Dr. Germaine Spencer with Get Well apps, Dr. Sheridan Lee with iDoc. We need all apps available for home-based care to be available on telemedicine platform. Very, very important. But WhatsApp is still remain quite a simple and easy tool to use. In terms of when to start treatment, all symptomatics need to start immediately. For those who are asymptomatic with a positive COVID test, we recognize steam and oral hygiene. And Dr. Phillips was excellent in terms of telling us the importance of oral hygiene on top of coronavirus. Do not rely on a positive test. Sometimes the test is negative today, negative tomorrow, negative on Sunday, and then it finally becomes positive on Monday, but you still have COVID. And all this time you're losing ground because the test is not 100% in picking up. But if you, for instance, have the classic setup that you have family members or friends, close contacts that have had positive tests, and you now develop headaches, cough, loss of smell, loss of taste, tiredness, syncope, fever, headaches, and of course with the Delta virus, we're seeing less respiratory illness. We're getting more of abdominal pain, muscle pain, aches as well, diarrhea. But chest pain, it remains a very, very dangerous symptom. You must have someone that will help you. You cannot be alone when you're treating COVID. Remain in a localized area of the house. People should wear masks inside the house to minimize the cross infections. But also we should kind of reduce the amount of intake that we're having to get smaller, more regular portions. And of course, brushing your teeth after every meal, steaming, oral hygiene after every meal, smaller quantities, but lots of fluids, lots of juice, 4 liters per day. We're still in a very hot part of the year. We need to drink a lot of fluid. We must buy a urinal. It's much easier sometimes, especially if you're drinking a lot of fluid in the night, rather than getting out of bed where you may actually fall and hurt yourself. To have a urinal nearby, especially for males, it's easier to apply that situation. Deep breathing exercise is very important, and gentle cupping of the chest is also very important. We must check our oxygen saturations quite regularly. Once you have this device, the pulse oximeter, you can apply it liberally. Oxygen sats below 75% that do not respond to steaming, you must go to the hospital immediately. But we have patients with saturations like at 79% like myself. Once you steam and sats go up, then you can still continue with early treatment at home. We have other tools such as monoclonal antibodies, Actemra, very expensive, $240,000. We know Caramed has it. Remdesivir, also quite expensive in that sort of range. These are more moderate and severe, and certainly you want to get this applied before patients enter into a very severe or ventilated state. Unfortunately, in Jamaica, ventilation continues to not yield good results, and almost everybody dies who put on the ventilator, and that's something that we can discuss at the end. The government needs to immediately provide a free therapeutic headline. If I tell you that I've gotten 100 phone calls between 8 a.m. and 12 midday, I am not lying. That's how that's how the great urge and need for a therapeutic helpline just to guide people as to what to do in this massive outbreak that clearly has overwhelmed our hospitals. and left the government trying other alternatives. All public spaces, churches, bars, cinemas must have a pulse oximeter. Insurance companies need to also align their compensatory procedures that will also facilitate doctors investing in pulse oximetry so that they can refresh and renew. And call on government to remove all taxes and to provide support for things like a pulse oximeter so that everybody can have one. Now, this is a busy algorithm, but it's really worked. It saved me quite well. And we have shared it with doctors all across Jamaica in primary care, and they're now applying it and using it with success. How do I know that? They're giving me back the feedback, and they're telling me how their patients are doing. No one is dying. People are holding, people are keeping off oxygen by and large, and people are doing very well. So in terms of the clinical algorithm, we have two sets. If you're clinical COVID positive, that if you have the classic features of COVID, even though your test is negative, I still recommend that we treat for COVID. If your test is positive and you're symptomatic, we're definitely going to treat for COVID. If you're asymptomatic, what you should try to concentrate on is the first line here. Steam for 30 minutes, 3 times a day, best after eating. We can steam with menthol crystals. We can steam with eucalyptus oil. We can steam with Vicks Vapor Rub. Added to the hot water. We can also steam with salt water. There's a lot of options for steaming, but we must steam for at least 30 minutes 3 times a day. Floss, brush, Listerine 3 times a day. Gargling, I would recommend that we should gargle probably for 70 seconds, and we need to time it, because if we can reduce, it's all about reducing viral load. If we reduce the viral load, then we're reducing the amount of spike proteins and bacteria that follow it that will lead to inflammation in our bloodstream. We're reducing the amount of thrombosis in our blood vessels. All patients must steam. In terms of this magic drug called ivermectin, it's been around for 40 years, Nobel Prize awardee, very safe. Even in pregnancy, it is still safe. So we certainly recommend ivermectin. We recommend vaccination for everyone. At this point in time, we can't mandate it, but we certainly recommend it. And we need to find more evidence where we can actually mandate it. Today, we have 150 people dying in the UK, a fully vaccinated country, and they're seeing a massive spike without winter being here as yet. So vaccination is a part of the solution, but not the only solution. So we need to have that very clear. In terms of the saturation below 85%, it doesn't respond, hospitalization. Temperature above 99 degrees Celsius. Just recently, I had a patient who had a temperature of 103, stripped him down. Family stripped him down under our guidance, brought his temperature down to 98.8 in the morning. He was sitting up having breakfast. A high temperature will lead to delirium and all sorts of things, but you need a doctor to help you with that process, to help you guide you through that process. In terms of needing antibiotics, certainly if you're having a temperature, I would recommend that everyone be on antibiotics, whether it's from Zymax, Zitromax 500 or levofloxacin 750 milligrams for a week. Combine that with Zinac if you're diabetic. I like to use 2 antibiotics just for 7 to 10 days, just to be safe. As a neurosurgeon, I do not like to see infections. Infections of the brain are very lethal. So we would always be very aggressive around infections. Unfortunately, COVID infections that have left untreated can lead to massive thrombosis and negative outcomes. And certainly, as I said, anywhere you go in the world, whether Jamaica, New York, if you're on the ventilator, you are in dire straits. Blood thinners are very key as well. Once you're in a moderate or severe category, you should be on a blood thinner, not just aspirin if you're in mild, but if you certainly have your SATs below 95%, you need to be on a stronger blood thinner like Xarelto, which I like to use. 15 milligrams stats, 10 milligrams daily. There are others like Pradaxa, Eliquis, and so on. Clexane can be used in pregnancy. It's perhaps favored by the obstetrician. Germaine can comment on that for us, but we should try and get Clexane to, for the pregnant ladies, but blood thinners are very crucial. Dexamethasone. Neurosurgery uses dexamethasone, neurology all the time. We welcome the news that dexamethasone from last year was shown to improve outcome. I use dexamethasone. Once you have SATs less than 95%, we're going to put you on dexamethasone. If you're diabetic, we're going to add some antifungal because of the risk of aspergillosis and black fungus. So this is a very, very important slide. You can take a picture with your phone, you can screenshot it, but this is something that have kept my patients safe, and we have kept everyone out of hospital thus far, and we have kept everyone alive. And for me, a lot of patients, we do not need oxygen. We must recognize that open ventilation, we must not shun the sun, and physiotherapy, deep breathing exercise are important. Supplements are important, vitamin D, 5,000 units, C, E, and so forth. We can always get this guidance from your doctor. Try and get sun baths, 30 minutes in the morning, 30 minutes in the evening. Home physio is now available for COVID patients. So home-based care, early home-based care, early treatment, it's effective, it's cheaper, it's convenient, it's comfortable, the family-oriented, there's privacy, there's dignity. We need our children to go back to school. Majority of doctors that we have interacted with do not support mandating children to take the vaccine. And we certainly recommend that children 12 and older will make themselves available for the vaccine. However, we think that there are some parents who are going to be reserved about the vaccine. And so we do not believe that children should be disenfranchised anymore, that they should be left out of school, because we know a lot of children, 120, perhaps 200,000, have been permanently harmed because for the past 2 years, they've had zero education. So we want the government to rethink their approach about mandating vaccines to go back face to face. There are a lot of children who will simply be left further disenfranchised, and we cannot conceive a third year of children with zero education. This will help to fuel crime and violence, which is a bigger public health problem in Jamaica than COVID at this time. So we call on the government to try and include all children in the face-to-face, that they should not be harmed any further. Moderation, we must avoid hysteria. Remember Jody and Farron and several others last year. We must avoid totalitarian rhetoric, implying that, you know, all sort of things. We need to treat early, including monoclonal antibodies are very expensive, and we call on the government to apply a subsidy so that monoclonal antibodies can be available to the common man. And remdesivir likewise. We recognize, like in Florida, where there are monoclonal antibody centers, that people can go and get it freely. And the United Kingdom, we are seeing also where on the NHS, these monoclonal antibodies are actually freely available. And we recognize, like Donald Trump, for instance, who got COVID last year, got monoclonal antibodies and had an amazing recovery. Home-based treatment is extremely effective. We want everybody here to be COVID competent. Start the premise of oral hygiene and steaming, and that will save a lot of people. All doctors must report for duty, regardless of their specialty. Whether you're a psychiatrist or dermatologist, all doctors, all allies must become COVID competent. A lot of pharmacists are also engaging with patients and saving lives. We need COVID champions and COVID competence. I thank you for listening. We're gonna have a lot of questions to answer. And so we're gonna go back. I'm gonna stop sharing my screen and go back to the meeting. Okay, is Mayor Mitchell here? Can we have a break now for some testimonials? Is Mayor Mitchell able to be, unfortunately, I think we have exceeded our 1,000 capacity with 77 waiting to get in. If Mayor Mitchell, can you unmute yourself? Okay, no, can we hear from, we have invited some people to speak who have had COVID and have treated at home or have their loved ones treated at home. Can we have them, show of hands, and just unmute yourself and to join the discussion? Roxanne Silent, are you with us? Can you unmute yourself? Okay, we're not hearing. Okay, is is Roxanne? Can you go ahead, unmute yourself? Can you unmute yourself, and can you unmute? Oh, let me go back to security setting. Can you unmute yourself? Roxanne, I'm seeing you in the meeting. Can you unmute? Right. Okay.
Hello.
Hello. Yes, we're hearing you now, Roxanne. Go ahead.
All right. Good night, everyone. My COVID journey started in April. Myself and partner, we both got COVID. I got it a few days after he did. His lungs collapsed. We were here thinking, you know, simple flu, and so about a week after he started to cough and just started to expel a lot of blood clots and bleeding from the nose. Rushed him to Andrews Hospital. They said that his lungs had collapsed and he was positive for COVID. luckily we were able to get a bed at UWI. When I went there and we were processing, they also encouraged me to do the COVID test. That was on a Sunday. I started having symptoms on the Tuesday, and it was the Thursday that you called to say that I had COVID, but I started having all of the symptoms and everything. So I called Dr. Hunter, and because of a lot of comorbidities, about 6 doc.
Yes.
All right. I am immunocompromised. So he immediately mobilized my sister to go to the pharmacy, got an oximeter, menthol crystals. He called in prescriptions for some of the medications he mentioned, the Xarelto, the levofloxacin, that's the name?
Levofloxacin.
You know, all of these, right, all these antibiotics and everything. The steaming 30 minutes. It was a rough time. I would say I was moderately ill, but what I can say is one night in particular, when after 2 a.m. I was on the phone with Dr. Hunter, and he was just carrying me through the paces. My chest was bursting. I had pains breathing, and I stuck with the steaming. And I don't want to be graphic, but the phlegm that I expelled from my body, if you can picture lifting up a slice of pizza and the cheese, how it stretched, that's exactly the thickness and the consistency of what came up. It was also riddled with a lot of air bubbles, and my oxygen level, because he encouraged me to monitor. So I had an oximeter, and I know the last picture I sent to him, it was 72. That was before I called him the 2 o'clock in the morning. I woke up, my fingerheads were blue. I was extremely cold. I could hardly move. I could hardly breathe. And I was on the verge of calling the ambulance, but because of the conditions that I have, he was a little apprehensive to send me to the hospital because more than likely I would have picked up an infection there. So that's why we chose home treatment. I stuck with it, the gargling, the whole oral hygiene, everything that has been described so far by all these doctors. That was what was recommended. That was what was done. And I came through. I was contacted as a contact for my spouse. And the Ministry of Health, they kept tabs on me and everything. The thing is, at the period when they thought I should have been over it, they had to extend my quarantine for 7 more days because the fever just would not go away. Then I developed a cough, but I still stuck with the steaming and also chest exercises. Son had to get some more antibiotics, things like that. But I must say that the whole advocating for the home treatment is good. My spouse, when he was in the hospital, the experience wasn't good. Just being away from persons. The nurses and so they were good, but he had orderlies checking his blood pressure. Now, if you are feeling sick, you think you're facing death, and to see a non-medical person check in the orderly. I'm not saying that they can't, but in a hospital setting, you're expecting. So you'd prefer to have a family member doing that. It's a frightening experience. You feel alone. So as Dr. Hunter and the other doctors are saying, the family in home setting is good. I had a support system. I had persons dropping off pots of porridge and soups and things like that. They leave it downstairs because nobody wanted to be in contact with it. So they leave it on the car in the garage, and you crawl, go downstairs because, I mean, moving up and down during that time, you could not breathe. You'd have to stop to take your breath, things like that. And what I'd like to encourage persons to do is, I've heard a lot of stupid rumors. Somebody point blank tell me that they would never catch COVID because they're not nasty. I don't know what that meant when they said that to me. I don't pay them any mind with that. I would just encourage persons to wear the mask. get your vaccine, follow all the protocols. If you are feeling sick, whether you feel flu or sinus, just assume that you have COVID until otherwise, until it is confirmed that you don't have it. Just start, you protect yourself, you protect others, you stop spreading it because you have it and it may just present as a little sniffle for you for an hour or so. You get in contact with somebody and they end up in a battle for their life. You cannot determine that for anybody. I had 3 bad days with it, and if it was not for all these advice that I got from Dr. Hunter, I don't think I would have been here today. But I was really afraid of going into the hospital, as I mentioned before, because I am susceptible to catching infections easily. So I'm thankful to him, and I'm just encouraging everybody. I mean, yes, you can drink your teas, you can drink your this, but there comes a point when you will need the care of a doctor, you will need antibiotics, you will need medication. Everything has a role, everything has a, plays a part in getting well, but you must get to know your body and know at the point when you say, okay, I can't do this alone, I need professional help.
Thank you, Roxanne. Thank you for that contrasting journeys between your partner and yourself. We know that the doctors and nurses and orderlies and everybody in the hospital, they're working flat out to get good outcomes, but there are limitations, of course, and it's interesting to see whether you're better able. If you have some help, you must have some help to be able to apply home-based care. But the whole aspect of being away from your family, that adds a lot of stress. And so we're very grateful that you were able to have that support at home to manage with your several comorbidities. We heard from Senator Tom Tavares Finson last week, Wednesday, and he testified that he was absolutely shocked that you actually made it, especially made it from home, because with your burden, it was hard to conceive that you could come out of it. And I think these things happen. 104-year-old patients live at home getting through COVID. Yes, there may be points where people go to the hospital, but we need to understand that the hospitals are no longer able to serve the nation's capacity demand for COVID. And so we recognize that you need to have support. You need to have support if this is going to work well. So thank you, Roxanne. Thanks for that contribution. We'll take another experience, Kimberly. Is Priscilla, can you unmute yourself? Are you having a patient sharing a patient experience? Are you having a patient experience, Priscilla? No? Okay, Kimberly?
No, I'm just waiting to ask questions.
All right, so that's Q&A. Okay, Kimberly, can we have your shared experience, please?
Hi, good night. Good night, Dr. Hunter. I'm so happy you invited me to share my experience. I had COVID. Relative woke up with a severe headache, chills, and was just feeling very unwell. And they told me they wanted to be seen by Dr. Hunter. And I said, Dr. Hunter, who is that? Because I know all the family physicians, and this wasn't a familiar name. And they told me who he was, a neurosurgeon, consultant neurosurgeon, and I reached out to him on social media. I messaged him on LinkedIn and Facebook. Surprisingly, he contacted me that evening. And by that point, the relative tested negative. However, Dr. Hunter shared the protocol with me. It turned out to be very helpful to me because I contracted the virus and was steaming for 10 to 15 minutes. But when I started the 30 minutes, it was a significant shift for me. Roxanne mentioned the phlegm. It relieved the congestion. It cleared the nasal passage, cleared my airways. And 2 days after I started steaming, I tested negative. And since that time, Dr. Hunter has checked in. How are you? Are you steaming? How is your saturation? Are you staying hydrated? And I don't know Dr. Hunter personally. And he has since helped my friends for free. And I just want to thank you publicly, Dr. Hunter, for being so accessible and sharing your wealth of knowledge and experience so freely. And to strangers, we need more doctors like you around. the first meeting you hosted, I was in tears looking at how many doctors took the time from their busy schedules to share their information. So I'm saying keep doing what you're doing and keep sharing the information. And you need to host a conference, Dr. Hunter, looking at the stigma, because I want to tell you now, so when I go places, people running from me, oh, she had COVID. And I'm like, well, be around me, I have antibodies. So the next conference, I'm saying devote it to the stigma. People you don't want to get COVID, nobody don't want to talk to you. And the at-home treatment is so important. Roxanne again mentioned family. You know, my caregivers were my elderly parents, and I couldn't imagine being in the hospital, not being able to be in contact, you know, and have this love and support. So thank you, Dr. Hunter. And Dr. Hunter doesn't sleep. So he messages at 3 and 2 and 1 o'clock.
We cannot rest. We cannot rest, knowing that, you know, I'm going to say the story again. What really drove me into action in terms of the COVID, and yeah, I mean, last year the UK sent for me, they sent me automatic registration. Normally pay £1,000 just to get the license, and they did it for free. And obviously there was an emergency, but sadly the seaports and airports were all shut. So immediately I recognized that I'm waiting to hear from central government. When is the government gonna reach out to the private independent practitioners to help? Anyway, we're still waiting. But having said that, in terms of what really got to me was this gentleman by the name of Vincent Thompson. And if his widow is here, I'll pause to let her unmute. But Vincent was a great botanist in Jamaica, and there's a black IP that's named after him. But his wife, who was battling with cancer, he made sure that he went and did all the rounds instead of allowing her out. And at 71, 72, 73, he contracted COVID. Sadly, because you know that I'm a busy schedule, I wasn't contacted till like a week later, at which point he was really delirious, someone who's starving for air, totally hypoxic and delirious, confused. It was too late. So 12 hours later, he died at the Maypen, at the hospital, rather. Sorry, not Maypen. He died at the hospital. And that really said, no, I will not allow another patient, if I have anything to do about it, to die in this way. And so we have applied a diligent methodological approach, including not sleeping, not resting, until everybody who needs COVID care can get it at home. And sometimes the support is quite simple. As I mentioned, a 103-year-old patient, just bringing their temperatures down. But enough about me. Let us hear from Miss Nervelyn Crooks. She's all the way from Hanover, the wonderful parish of Hanover that was really sterile for a while, was leading Jamaica's corona cases. Miss Nervelyn Crooks, can you unmute yourself? Can we hear from you, please?
Dr. Hunt, and good night, everyone.
Good night, Nervelyn.
Are you hearing me, Doctor?
Yes, Nervelyn is a teacher, a guide, a builder of the nation. Yes, we are hearing you loud and clear. Go ahead.
Are you hearing me?
Yes.
Okay. I'm saying good, Dr. Hunter, good night to everyone. Dr. Hunter said, and I'm from Hanover. So just since 27, very serious conversation. Of a complication with my neck, my C3 are completely destroyed, and he did a surgery, a 9-hour surgery. It was very, very successful. He was a complete stranger at the time when he did my surgery, but he was my brother, since then, and I had a very since then I have no problem. He ordered soup for me after 9 hours, my soup. Now, when this year, I didn't know I got it, but funny, a strange feverish head. However, my mother died and they did a COVID, and on March 14th, a little sick. They called me from COVID. So since that day, before they called me, I isolated.
Okay. No. Okay, we're having some difficulty with Neverland's connection in and out.
If you call Dr.
Neverland, can you perhaps change your position? You're coming in and
12
out.
in the night, and it doesn't.
Okay.
I'm coming in and out.
Yeah, you can change your position. Can you? I'm gonna take Nurse Celia Jackson, a critical care nurse's experience between over home-based care, and we're gonna bring you back in towards the end. But Nurse Jackson, can we hear from you, please?
Hi, good night, Dr. Hunter. Are you hearing me?
Yes, loud and clear. Go ahead.
All right, good night, everybody. So my family member contracted COVID. So I have two experiences really. I have the experience of a more distant family member, an in-law, who got COVID and took very long to seek attention. And the person was hospitalized, did not have any underlying comorbidities. Yes, a little bit older than my other relative, but was very healthy. By the time I contacted Dr. Hunter because we needed to get access to some medication, which we got for the person, and unfortunately, she died. Healthy person was hospitalized, but she did take long to seek medical care. She took long to reach out, nobody knew what was happening, and so unfortunately, she died. Fast forward to a couple of days later, a relative of mine, a closer family member who was not in contact with that other person, started exhibiting symptoms of viral infection. He became fatigued and had a slight temperature, like a low-grade fever, 99 or 0.9. And he also complained of a very pounding headache, but that went within a day. But immediately as he started complaining, having spoken to Dr. Hunter about the early home-based treatment and with knowledge as a registered nurse as well, we immediately applied those interventions. He started steaming, he started taking his antihistamines, he started accessing sunlight during the day and rest, along with some amount of physical activity. All of those things were implemented immediately. So his symptoms, they are minimized. We got the O2 sat monitoring done. Everything, his temperature was done empirically. And then about day 4 or 5, we decided to get him tested now because the symptoms were there, even though some of them had abated. He still manifested symptoms of a viral infection. He had a slight cough, didn't last for very long, but everything just, different symptoms were exhibited. So we did the test day 5, and it showed that he was positive. And I just want to pause here. One of the main reasons why I encouraged him in particular to get tested, apart from the fact that you want to know, if you know that your lifestyle is a busy lifestyle, get tested because you'll be saving many other persons. And he's a very busy person. So if he wasn't feeling too badly, he would have been out and about. And I wanted to avert that. So I encouraged him to get tested, even though he thought that he wasn't as badly. And so we continued with the interventions. Dr. Hunter added the antibiotics. He added an anticoagulant, a blood thinner, because of a family history of clots. He also added Montelukast. He encouraged what we were doing, the length of time for the steaming. He told us to do half an hour at a time. His saturations never went below 93. I think it went to 93 once, but it was maintained between 95 and 98. Now he's 99. He's on day 11 now, and he's doing very, very, very well. Almost all symptoms have abated, and I'm still encouraging. He's still at home, and he's continuing to be on the mend. So we're still doing the same things. He's wearing his mask in the house. He's quarantining. He's doing all the things. Unfortunately, he did not get his vaccine. And I just want to encourage us to adhere to the protocols. But if you get infected, if you suspect that you are infected, seek early intervention so we can minimize the transmission and we can minimize how it impacts us, because as we all know, the hospitals are under great strain, and we want to minimize the number of persons who are hospitalized. It's a very lonely place at this time. And it's just awful for you to be there and your relatives to be there, and you can't hold their hand or even talk to them, even if they're gonna die, you know, which we are trying to have.
Okay.
Intervention if you have COVID. If you suspect you have COVID, reach out to your medical practitioner, let them advise you, and just do the right things. Thanks, Dr. Hunter.
Thank you, Celia.
You
And
have been very supportive and appreciated.
Thank you. And you are a critical care nurse. You are the Rolls Royce nurse profession. But I know that you have many other hats. So I want to thank you for sharing that experience and to compare and contrasting the two different outcomes. Key is early treatment. Early. And if you catch early, remember, nobody becomes in coma, as Dr. Leroy HAYMAN will tell you. Nobody starts out in coma from day one. Nobody starts out in a ventilator from day one. You need to tell people if you're ill. And I salute Kimberly for bringing the point up. We need to get rid of the stigma associated with COVID, so that people, especially if they live alone or if they're a bit private, that they come out of their shells and say to someone, I'm not feeling well. It could be COVID. We need to say openly, I had COVID. And that's why I'm telling the world, I had COVID and my antibody levels are high. We need to get comfortable with releasing that aspect of our medical care, because this will save lives. By destigmatizing the disease, we can get someone to come in that much earlier for treatment. So I'm going to take a pause at this point in terms of the testimonial. You've heard several powerful stories, firsthand stories about really, this is not just theory, this is practice, the application of our algorithms. You've seen it live and in person, that these are not, we're not talking theory. We saw the 104-year-old lady in the Gleaner on Sunday. This is not theoretical. She also a nurse. So the question is, why are nurses and people dying in government hospitals in such great numbers? Singapore, 65,000 deaths, 65,000 infections, only 50 deaths. Why? We need to answer that question. And we're saying several doctors, Dr. Germaine Spencer, Dr. Sheridan Lee, Dr. Leroy HAYMAN, Dr. Michael James, Dr. Susan Manuel Arscott, they're telling you that we're treating everyone and we're having no deaths. We're having no deaths by treating early and at home. So we need to quickly reconfigure the thinking. Anyway, enough of me. I want to hand over to Dr. Leroy HAYMAN. Can we have you, Dr. HAYMAN? You're listening? No, we've gone quite a bit of time already. Can we have you to do your presentation, Dr. Leroy? Over to you, Leroy. Are you here?
Good night, everyone. I'm here. I just need to get my video going.
Okay. Can we take a question in the meantime? Just quickly, I think Yvonne, can you unmute? Is it a shared experience, Yvonne, or is it a question? Is it a content question?
Good night, Doc.
Is it a
question?
It's a
And
question.
this is Courtney. Yes, Doc. First, I want to tell you how very much I appreciate what you're doing, and I think it's a wonderful job. Hope you live as long as possible to continue this work. However,
Let us all be COVID champions. We can do it together. COVID champions.
That is what I was.
Let us use this media, the shared experience, to share our stories. You have come and witnessed. You're a living witness to what you've seen and heard today. And this can empower you to save lives. Save your neighbor next door. Go ahead.
Yes, Doc. My question is, what are the things that the COVID champion does on a practical basis?
One,
COVID champion.
Like
Describe what he
doing.
does.
First of all, 99.9% of people in this world would not have heard about the word coronavirus. So you must first become knowledgeable of what's a virus. What is coronavirus? The word novel has disappeared from our architecture this year. It has gone away from our linguistic expression because people realize it's a virus that's been around for a very long time. So you need to empower yourself through knowledge. And I welcome that you've taken the time to join us by learning. So you become a COVID champion first by speaking from an experiential point of knowledge, first-hand experience. Once you go, you know. They say seeing is believing. So you must empower yourself with knowledge. Now you can gain knowledge through reading, through the internet, through TV, but when you gain knowledge by attending and seeing people directly and witnessing the conversation, then you are now better off to approach your neighbor. We heard Dr. Phillips start us off by telling us why it's important to have good oral hygiene. Good oral hygiene is a good starting point to helping reduce our numbers. And we've called for a month period of oral hygiene. Brush, floss, Listerine, floss, for one consecutive month. From 21st of August, we've started to the 21st of September. And if every household in Jamaica, every member, every Jamaican, every resident of Jamaica practices oral hygiene, I guarantee you our numbers will fall. So that is what I want. I'll come back to the question. I don't want to go too much more. I want the chairman, Dr. LEROY HAYMAN, to give his presentation. LEROY, are you ready? No? LEROY? Okay. All right. Whilst we wait for Dr. HAYMAN. So, Courtney, can you unmute? Let me see.
Yes, Doc. Just to follow, specifically, a doctor who is a COVID champion, what would then be his approach as against a doctor who is not a COVID champion in dealing with a patient?
All right. Again, if we start from the perspective of hysteria, people use the word novel. The WHO used the word novel. And so with this novel, there's this the natural human tendency not to engage with the condition. And so, no, we don't treat COVID. And we're saying, no, all doctors everywhere in the world must have COVID competence. They must at least start to approach COVID rather than, because COVID is everywhere. We can't be sanitizing the building every time there's a patient. So COVID is everywhere. So COVID champions, not just for the general public, but also for the doctors and nurses and physiotherapists and everyone in the health, they must have a basic understanding of what to say to someone who has COVID. So get a pulse oximeter, something as simple as that. Again, 99% of the world would not be familiar with that term last year. Now we are comfortable with a finger pulse oximeter like this. Everybody must know a finger pulse oximeter, right? So just knowledge. And what
Dr. Hunter,
yes,
can you hear me now?
Yes, you're back now. Yes. Can you have your video on?
Okay, perfect.
Courtney, we'll come back to you.
Perfect.
We'll let Priscilla. Okay, thank you. Go ahead. Go ahead, Mr. Chairman.
Okay, good night, everyone. And thank you for being a very important part of this very informative forum. I know you are learning a lot from what we are sharing. And I want to thank also our patients for being here tonight to share their experiences as a testimony of what we are saying. Our fundamental message is we are recommending early treatment. We will monitor you in your homes. And what we're seeing is that this has resulted in less hospitalization and indeed less death. Now, I want us to understand that the COVID-19 infection is a real infection. It's not a hoax.
Sorry,
and it's an infection.
LEROY, can you turn on your
yes.
video? Can you turn on your video? Is your video on? So that we can see you.
Yes, Doc, his video is on.
Oh, sorry, my apologies. Go ahead.
Okay, right. So as I was saying, and if it is not addressed in the early stages, it can result in significant major organ damage, including your lungs, your brain, your heart, and your kidneys. Now, before I go into this presentation, I want you, everyone on this forum, to realize that everyone on this forum, or the presenters, we believe in prevention with the vaccination. And so if you're not yet vaccinated, we recommend that you do so as early as possible. The data is true, the reports are true. Persons who are unvaccinated, they are going to have severe illnesses. and vice versa, those who are vaccinated, they end up with a less severe infection. So we cannot overemphasize the need and the point that we all need to be vaccinated. Just a caution now, since the cases are increasing rapidly across the island, if you have symptoms, you're about to go to tested before you take the vaccine, because we have seen some really adverse reactions if you are coming down with the infection and don't take the vaccine at this time. We organization guidelines, you can do so after 3 months, up to 6 months, and then you can safely take your vaccine. So the primary message really is, yes, take your vaccine. It's very, very important. But these forums are planned and organized especially for the many Jamaicans and people across the world who are listening to us, who for some reason are getting infected and you wait too long to get medical attention. And so you end up going into the hospital. And as we're seeing, our hospitals are already overwhelmed. I called Maypen Hospital today on behalf of one patient. And the news I heard was that we are 60% over capacity. They can come, but they have to stay maybe in the corridor and get treatment. They'll be looked after properly same way, but there's no beds on the isolation ward. And many hospitals are like that. Spanish Town, I saw in the news yesterday. In Westmoreland, we saw that in the news again. And our hospitals are overwhelmed. So this is a time for you to pay attention in the early stages of the disease so your outcome will be very good. And so what we're presenting to you is almost like a pre-hospital management. It's almost, we're strengthening the tertiary prevention by treating you and so early, so the outcome is very, very good. Now, I want to define for you all what I mean by early. And by early, we're talking about the first 6 days of your symptoms. Now, if today, the 25th of August, you start to have a headache and a little sneezing and a little cold, that is considered the first day of your symptom. Now, we need to understand that it is not today that we picked up the virus. The virus was picked up from approximately an average of 7 to 8 days prior to that. Now, I want you to understand that when you look back at the previous 8 days, it will tell you where you went without wearing a mask or what you did out there. You might have gone to a wedding and didn't, while you were eating, well, obviously you have to take off your mask. And perhaps that's where you got it. But when I talk of day 1 of symptom, you actually picked up the virus maybe 7 to 8 days prior, maximum maybe 14 days before the symptoms start to show up. Now, why is it that we are focusing on the first 6 days of your symptoms? Now, when you pick up the virus 8 days before your the symptoms start, a series of changes start to take place in your body. Your body automatically start to mount an immune response, meaning that your protective mechanisms, your antibodies, your white cells, they start to fight for you. And in fighting for you, it causes an inflammation of your organs. And so that's how the symptoms start to arise. Your headaches come on, your fever come on, your diarrhea comes on, the coughing comes on. So this inflammation starts. And then secondly, what happened also is that the virus is trying out to multiply as fast as it can during that period also. So the aim of our treatment in the first 6 days is that we want to decrease the virus from replicating or multiplying. And we also want to treat your early inflammation. Now, when we speak of early treatment, we're not talking about treatment at home and not going to the doctor. You need to go to the doctor, and I tell you why. When you come to the doctor in the first 6 days, we do an assessment of you. We listen to your complaints. We look at your medical history. If you have any past medical condition or comorbid medical condition or underlying existing medical condition. We look at your weight, we look at your symptoms. So we look at your overall presentation at the time you come to the doctor in the first 6 days, and we put you into what we call a risk category. Now, the risk category can be either mild risk or moderate risk or severe risk. And it is that we use to try to implement treatment so your outcome going into the second week of the infection would be much better, and you will have less symptoms and less infection process to deal with. The previous speakers have mentioned we do 2 things here. We also manage your comorbidities. We manage your chronic medical conditions. We make sure your diabetes is controlled. We make sure your blood pressure is controlled. We make sure your asthma is controlled. All your other medical conditions, we try our very best to bring you to a level of control that will prevent the disease from progressing. So we don't want you to stay at home and apply the measures we say. We want you to go to the doctor, let him assess you, treat you for your medical condition, put you into a risk category, and then we start initiating the treatment. Our treatment in the first 6 days is twofold, what we would consider as pharmacological and non-pharmacological. The non-pharmacological, all the speakers have defined them already. We talk about the isolation, and by isolation we mean you have to be in a room by yourself, with preferably your own bathroom, but we know that's not possible for every single person. So we look at your individual situations in our offices and we try to work out for you the best options. We try to advise you on the best options to take should in case you have to share, like say, a bathroom. We work out all that for you. The steaming was mentioned before. We also look at your fluid intake and we advise you on how much fluid to take. We also encourage you to start doing mild exercises, which I've heard before, which include walking, deep breathing, and perhaps blowing into a balloon to start early physiotherapy. And then for the medical part of it, the pharmacological part of it, when we look at your risk, we will apply medication to you that will help you to start getting good results, start to decrease the inflammation, start to decrease the viral replication. And so you are much better off in the first 6 days now going into the 7th day or the second week. Now, what do we do at home? It's simple, as Dr. Lee mentioned, you have our numbers, we have your numbers. And so we encourage you to call based on your risks. If you're high risk, we allow you to call us every day, or we will call you. If you're moderate, we say every 2 days. If you're mild, we say every 3 days. And of course, we recommend that you keep in touch with us so we can know what is happening to you, so we can apply more treatment if it is required in the first 6 days. One of the things we're finding out at the hospitals is that when your symptoms are mild or even moderate and you go and it's not time for admission, sometimes when you go home, if you're not advised properly, if you're not calling your doctor, your physicians properly, what we're finding is that when they go back, they're going back into more severe illness and the outcome is really and truly bad. So if you get it right in the first 6 days, then I can guarantee you, everyone listening to me tonight, that your outcome going into the second week of the infection will be very, very, very good. So what we do after that is that we bring back most people by day 7, now going into day 8 of the infection. We do another assessment of you and we see if your symptoms are getting worse. And if you are having signs like crackles in your chest or urine problems or chest pain suggesting heart problems, we assess you again, and then we start you on appropriate medication during this next 7 days to make sure that your disease don't spread or get worse. So if you are mild, when we see you back on day 7, your symptoms are getting better and we still categorize you as a mild, then perhaps you won't need any more treatment. You go home, we continue to monitor you, you call us, we call you, you continue to do the non-pharmacological things that we defined earlier, and we continue until day 14 when we call you back and we examine you again, and we say, if you're good, we say, okay, take a week or 2 to rest, to recuperate, and then we send you back into your usual normal daily activities or back into your workplace. If after we assess you on day 7, we realize that you're progressing, we have medications that we can use in the form of steroids, and as you have heard, blood thinners. We also look out for secondary infection if you're spiking a fever during this time, and we add the appropriate treatment, also antibiotics. Some people have fungal infections. We also treat those in the second week of your infection. Going back to the first 6 days, if you're showing signs of infection like a pharyngitis or a sore throat, bad sore throat, we will give you the antibiotic in the early stages to make sure we treat everything and nothing goes without the proper treatment. So we monitor you during the next week. So we bring back everybody at 14 days. And if you're better, we let you, as I said, get a 2 weeks of rest and then put you back out into your normal activities and then back into your workplace. We also encourage physiotherapy. We allow you to go through gradual rehabilitation. You continue your vitamins, and this is to prevent what we call long COVID symptoms. I am one doctor who believes that if you get treatment early and your infection is under control from early, you will not end up with what we call the long COVID symptoms, where you have heart problems, lung problems, brain problems, and kidney problems. As was Dr. Hunter mentioned before, nobody gets the symptom today, day 1, and jump on the ventilator in day 2. No, nobody gets the symptom on day 1 and end up passing out on day 3. No, you gotta go through at least 14 days before you reach that critical level if you do not do anything. So we can't overemphasize the fact that the first 6 days, that's what we define as early treatment from a doctor who is experienced in managing these patients. You get that treatment, we will monitor you from your home in the comfort of your home, and you will recover, and you will recover well. So what do we find as challenging? So far in my experience treating over 100 patients, I've had 2 patients with underlying conditions that gave a little difficulty. One was a diabetic who was, his family heard that he was sick with the COVID-19 virus, and they sent a lot of Gatorade rich in sugar, and his blood sugar went way out of control, approximately 30 millimoles per liter. And so he came in very ill, his oxygen level started to fall, and we had to address his sugar urgently. We got his sugar under control. His family was able to get oxygen for him at home. We monitored him at home on oxygen. He did exceptionally well. And today this morning I called him after 3 weeks of illness, and he's much better. He's moving around. I tell him to rest for another week before he goes back into his daily routine activities. So he did exceptionally well, but he gave us a challenge. We had to put him on oxygen. I have also another patient who I saw her in the 2nd week of her illness. She's presently being monitored from home on oxygen. We're monitoring her very, very carefully with the help of a professional nurse and physiotherapist. And we expect that our outcome is also going to be good. There's also challenges I've found with persons who lack psychosocial and financial support. Some of the medications do cost, especially the blood thinners. And so in some of these cases, we had to ask relatives to come in and help. Just to save them from going into the hospitals, we had to ask a few companies to come in and help, just to save them from going into the hospital. And having done so, I'm pleased to announce that nobody so far has gone into the hospital. So most of my patients have recovered. None so far have been hospitalized since April of 2021. And more important for us is that there has been no deaths from my medical management in central Jamaica, in Maypen, in the parish of Clarendon. So in summary, we can't overemphasize vaccination as being essential to prevent the illness. We recognize that you need to stop being hesitant, and we want you to go to the nearest vaccination blitz and get vaccination. We don't want you to get a severe infection. But if you do get an infection, then we're saying to you, the first 6 days, early treatment is important. We will monitor you in the comfort of your home, and you will not end up in the hospital, and more so, you will not end up dying from the COVID-19. It must be something else. And so most of my patients right now prefer home monitoring, even the very ill one prefer home monitoring at this time because of our communication with them. They can call us, we can call them. It makes it so simple for them. And if they're getting worse, we know exactly how to approach the situation. So this approach we're doing, it's definitely going to reduce the hospitalization, and there's no doubt about it. We hear the news every day. The cases are rising, the hospitals are overwhelmed. So right in your own home, as you get your symptoms, come to us. We will assess your risk factor, we will start you on treatment, and we will do our utmost best to make sure that your outcome is very, very good. I thank you for your attention, and I know in the days to come, we're going to see less people going into the hospital. We're going to see less death in this country, and perhaps it might reach a stage where the hospitals might be begging us to send patients to them for treatment. Mr. Chairman, Mr. Host, Dr. Onta, I pass over back to you now. Thank you.
Thank you, Leroy. As always, eloquent, very, very solid. Cannot argue with those experiential learning. And I certainly would not doubt that one day, in fact, the hospitals may actually be running us down to ask us where are their patients. No, it's really a wonderful journey. So, I mean, the Cuban health system is pivoted towards strength in terms of providing care at home in patients' homes. And I think with the embargo, they're struggling to do that right now. But really, home-based care is nothing new to medicine, and a lot of medicine started there. So thanks a lot, Mr. Chairman. Your experience is well appreciated and well accepted. I think that's the end of all the presenters in terms of doctors for today. Is Dr. Michael James here? Not sure if he managed to make it. You can unmute, Michael, if you're here. Not sure. If Mayor Donovan Mitchell came back just to share his own experience. I think he also had a battle with the virus, but thankfully he got spared and he is here with us. Now I'm going to go back into the experiential learning segment where we learn not just from doctors and dentists and doctors, but we also want to learn from our patients. I think patients have taught me so much. Any doctor that does not look to listen to his patient is certainly bound to fail. Those days are far behind us. We must learn and listen to our patients. They give us the clue. They tell us, they give us learning and vital knowledge that you don't see in a textbook. So let's get back some more patient experiences. And I'd like to start with the men now. Is Damien Joseph here? Damien, can you unmute your mic and just tell us about your experience with COVID and your COVID journey? Is Damien here? Damien Joseph?
Not seeing him here, Doc. You can move on.
I think we're getting bumped in and bumped out all the time. He did come in, but can we also have, is Junior here? Junior Mitchell, is he here? Michaela Mitchell?
Junior. Not seeing Junior Mitchell either.
And just do one more shout out for Damien Joseph, no? Okay, can we go to Raquel Mullings? Raquel Mullings, is Raquel, can we get Raquel?
Yes, Raquel is here. Go ahead and unmute, Raquel.
Yes, good evening.
Good evening, Raquel. Good night. Thanks for being here. Thanks for sharing with us. Tell us your journey so far.
Yes, thank you for this opportunity to share my story with everyone. Okay, my husband contracted the virus, and for day 1 to 5, he did mild exercise, drink lots of fluid, and he took his vitamins. Day 6 to 11, he wasn't doing any more exercise, and he didn't have any symptoms. But day 12, he started feeling some pain on the left side of his breast, under his breast, and it was intense. And we made contact with Dr. Hunter on day 13. And on day 13, he started to experience tightness in his throat, and Dr. Hunter assessed him. And, you know, for the record, we don't know Dr. Hunter, but he really assisted us. So for day 13, he assessed him, and the first thing he asked was his oxygen level. We didn't have the oximeter at the time, but when the pharmacy opened, we went and got it. And he was taking his vitamins along with medication that we got from the pharmacy. So the vitamins that we got, vitamin C, vitamin D, E, and zinc. And, you know, he's feeling a little bit better than before. And I must thank Dr. Hunter for assisting us, you know, via text message. And I implore everyone to get the oximeter. It is very, very important. And Dr. Hunter was very, he responded quickly to our text message, and we thank him very much. And, you know, he told us also that he should continue to do his steaming. And Dr. Hunter mentioned in the last presentation that every household should have a doctor's number. Unfortunately for us, we didn't have a doctor's number, but when we listened to the presentation last week, we quickly saved Dr. Hunter's number in our phone, and that is how we were able to reach out to him on day 13. So today, Wednesday, is the 15th day of my husband, and he's on having the virus, and he's on to recovery. And we really thank you, sir, for taking the time out to listen to our cry. And I'm sure other persons can attest to the fact that, you know, you are doing a wonderful job, and we must say thank you.
Raquel, it's been my pleasure and my honor to serve you. As I said, this is in fact a national duty. This, if England can call for me, then of course I am not, I must begin charity at home. I love England, it's a great country. Love great people there. But, you know, we're waiting to hear from our government, reaching out to our independent private practitioners and engaging with us. I certainly had a meeting with Minister Nigel Clark about 3 weeks ago, and we're yet to hear back from him. It's my pleasure and honor to serve every citizen of Jamaica, every resident of Jamaica, Jamaicans and non-Jamaicans. This is a worldwide crisis, and I would implore all my colleagues to become COVID competent and COVID champions and to engage with. And I just, from a personal perspective, chose to make my service freely available. But I'm not saying it's possible for all my colleagues, but at least you need a service that you can engage with. And we're calling on the government to set up such a therapeutic service. As you can see, COVID lends itself, certainly in the early stages, to treatment at distance with video, audio, messaging. And with the pulse oximeter in every home, you can measure where everybody needs to be and what they need to do. But everybody should be steaming and practicing excellent oral hygiene. So I'm very grateful, Raquel, for your sharing. And so I'm going to move on to someone else. Can somebody unmute themselves? I've invited several people. So if you're one of them, can you just unmute yourself and say who you are and share your experience? Thank you. No? Okay, we've had an, is Miss Crooks back with us? Miss Nervelyn Crooks, are you back in? Can you unmute yourself? No, I think Nervelyn's connection is a little bad. Okay, I think
I am in, Dr. Hunter. I am in. I just gonna unmute.
Okay,
Yes, I'm back
right.
again. I
Okay.
got
that sounds a
am
lot
right.
better. Can you therefore
Okay.
share with us your journey, your personal journey, and for your loved ones around you, and to compare and contrast? Thank you.
Okay, in March, I said I contracted the virus. I didn't know, but by the way I felt, I knew something was wrong. I went and I got tested and it was positive. I called Dr. Hunter and that's when my fears went away. He told me to get the vitamin C, 1000 calcium, zinc, vitamin D3, and the pulse oximeter. At the time, I didn't have the pulse oximeter, so I went and get it, but all of these I still have in my home. And he was the one who guided me each day throughout the COVID from day, I think it was day 3 straight back to day 14.
Just a minute, Nervelyn, I'm just gonna mute.
I'm
right.
sorry.
Can you unmute us? I'm gonna. All right, Nervelyn, can you unmute yourself again? Are you unmuted?
Yes, I am still on. I'm still on.
Go ahead, please.
Right. I'm saying from day 3 until day 14, I was monitored by Dr. Hunter and I followed all the procedures. I did my my steaming. I used to do it with eucalyptus oil because I didn't have them. I didn't know about the mental crystals, but the mental crystals, they were so good. There was a time during the 14 days when I felt a little bad. I had to call him in the night and he said, you start steam 3 times. So I went on with my steaming, and when I did that, I felt much better. And thanks be to God, it was through Dr. Hunter and our communication, text, and those things, he was able to carry me straight through, and I was better by 14 days. Other family members got the COVID too, but all of us, thank God, are well because of Dr. Hunter. I have everything in my home now, even though we don't have any COVID cases here, but I still have my oximeter, my vitamin C, caltrate. I still take all of them, and I still do my steaming even once per week. Very, very good. Thank you, Dr. Hunter. You're a champion, and you're the voice for the voiceless and the poor and for just about everybody. Thank you so much, sir.
Thank you, Ms. Crooks. Thanks for that very warm and comforting testament. And I'd like to just recognize that you are a teacher, a nation builder, and we certainly would like to see our children back in school. Can you just share with me some experiences that perhaps you may have about how many children logged on? I mean, you're in Cocoon in Hanover. I think most people wouldn't know where Cocoon is.
It's near Sir Alexander Bustamante birthplace, about a mile from there. But I've sent the link to my grade 2 parents. I teach grade 2, so I send it to all the parents and I send it to the teachers at my school. And I know they are in. I'm almost sure they are in because they told me they are in. And all my family members, my friends, relatives abroad, they must listen because they don't know when they're going to need this kind of information. And the information is free and it's real and it's good.
Thank you. And we certainly want to use this forum as we support children going back, all children going back face-to-face in school. That certainly we call on my fellow practitioners in the independent pathway and all members of the Medical Association of Jamaica, which I aspire to lead, to put in place a mechanism where every teacher in Jamaica can have a doctor's number that they can get support in case they have COVID, because we perhaps anticipate that not all teachers will in fact take the vaccine, but they all, whether you're vaccinated or not, you all need access to early home-based treatment and access to early intervention should it be required, or just simply early knowledge sharing, early advice as to how to deal with a particular matter. But again, thank you, Neverlyn. Thank you so much for that sharing. Is there anybody else who we had invited that can you unmute yourself to share your personal story with COVID, or even someone who has not been invited? Is anybody here? Can you just unmute yourself who had COVID and benefited from early home-based care? Faitlin, are you seeing anyone?
Not as if, Doc. I'm not sure what the raised hands are for, though.
I think those are for content questions rather than shared experience. So we're pretty much at the end of the agenda item. So now we're in the Q&A section. So we're properly in the Q&A. Mr. Chairman and Dr. Germaine Spencer, everybody's here. Shirley, are you here? We're going to be facing some questions now. We want as many people to have their questions answered as possible. And we'd like to recognize the clergy, the media that are here. We certainly try to facilitate questions from the media first. So if there are any members of the media who would like their questions answered, we're going to ask you to just identify yourself and to unmute yourself, and we'll have your questions answered first. Leroy, are you up? Germaine, are you up? All right, go ahead. Just say if you're from the media, just put your hand, just unmute yourself and ask your question. Anybody from the media? I know Kimberly is a media practitioner as well, but I'm not sure if you're actively within the media circle at the moment. So no one's from the media. Okay. All right. So the questions that we'll face are general questions. So let's get into it right away. Okay. Priscilla, can you unmute yourself and let's have your question, please. Priscilla? Priscilla is there?
Hello, good night.
Good night, Priscilla. Welcome. Thank you for being with us tonight.
Thank you as well. I just have a few questions actually. So these are questions that most Jamaicans have. I'm pretty sure that we have a lot of concerns out there and misinformation, and also I just feel like we're not getting adequate information, and I appreciate this forum. It has really, I'm pretty sure that a lot of us here have learned a lot. I personally, I'm not vaccinated, and before this meeting, I was like maybe 5% leaning towards vaccination. Now I'm about 25%.
You're getting there.
Getting there, because I need to have information as to what is going into my body and you know, whatever it is. And every Jamaican have a right to know what understand this thing as well. All right, so my first question would be, yeah, for persons who take the vaccine, right, or already vaccinated, right, can they contract the Delta virus? And if they do contract the Delta virus or the Delta variant, will they get moderately or severely ill?
Okay, Dr. HAYMAN, do you want to take that question, or Germaine? Okay. Any of our panelists? Can you unmute and just take that question, Dr. HAYMAN or Germaine? Okay, it's gonna be a long night. Oh, you can't unmute, I'm hearing. Okay, let me try to unmute themselves. Allow participants to unmute themselves. Okay. Can you unmute yourself, Germaine and Dr. Sheridan Lee? Can you unmute yourself?
Hi.
Can you?
All right, to answer that question, yes. To answer that question, the vaccine, as I'd said earlier, you can still catch the virus when you're vaccinated, but the chance of getting severe infection that will land you in the hospital or death, it should be decreased significantly. So I hope that answers your question.
Even with Delta?
Even with the Delta, it has shown that most of the vaccines actually are protective against the Delta as well. The Pfizer, the Moderna, and AstraZeneca are on the top ones that are protective against the Delta.
Okay, but you can still get infections even if you have been vaccinated, whether it's a Delta, the Lambda, the Theta, the Eta. We'll go through the Greek alphabet, but you know, with these respiratory illnesses, because you are vaccinated won't mean that you can't get a future one, right? Is that right, Dr. Lee?
Yes, just the severity. So remember, the purpose of vaccination is to decrease hospitalizations and not and deaths, and not necessarily infections.
Thank you.
Okay.
Next question.
All right. The next question I have is, should the government or should doctors advise or encourage their patients or people to do a full body checkup, right? Before they get vaccinated, because you know, they might have some kind of comorbidity that they are not aware of. Maybe they have heart problems that they were never diagnosed. Maybe they didn't start showing symptoms before, and you know, it is known that persons that takes the vaccine that has conditions that they weren't aware of, the vaccine can actually affect them in a negative way. So is it advised that persons do a full body checkup before getting the vaccine, and maybe over a certain age or whatever it is? Yes, that would be another question.
I think it's generally, can I just take that one quickly? WHO is very clear that if you have acute COVID infection or you suspect that you could develop it because of a heavy exposure, then you should have a pause on taking the vaccine and wait anywhere from 3 to 6 months until you're in a safe zone. What you should not do is to take the vaccine and have COVID at the same time. The difficulty that you'll face with a 50% positivity rate is that every other person will actually be faced with having COVID, whether mild, asymptomatic, or symptomatic. And so certainly with this high positivity rate, it would certainly be important that you go as far as to ensure that you do not have acute COVID or active COVID infection before proceeding with vaccination, according to the WHO.
Yeah, Dr. Hayman here, Dr. Hunter. So yes, we normally have one of the prerequisites to consult your doctor. I mean, that's comes from the public health office, to consult your doctor. And of course, that would mean an examination to make sure that there is no contraindication to take the vaccine. So yes, it's something that we would highly recommend. And the question you asked earlier is, yes, the Delta, if you're vaccinated, you can get the Delta variant, but from the information that has been reported worldwide, it seems that you're getting a very mild infection. We have a couple of cases out here, which I know of personally. Yes, it was only like flu-like symptoms. And so it is really true. The infection is of a much, much, much milder version than the one who is unvaccinated.
Okay, so so just to reiterate that basically, I understand that, you know, it makes sense. If you might have COVID, maybe you should get tested for COVID. Definitely should get tested for COVID before taking the vaccine. That makes sense. But on the other hand, other than you know, having COVID antibodies in your body or having COVID virus while taking the vaccine, can other health conditions attribute to side effects from the vaccine? And is this something that a person can do a full body checkup to ascertain this?
Well, I mean, persons who are on blood thinners, they definitely, we have to, display caution when it comes on to the vaccination. And so, yes, we do recommend that you do an examination to rule out, anything that might be there that may cause an adverse reaction.
Okay, thank you, sir. Thank you, doctor. Yes, sir.
Okay, get another question. Grace, can we get your question?
Dr. Hunter, sorry, if I may.
Yes.
If I may, Dr. Hunter, I have looked in the chat and taken out some of the common questions in the interest of time.
Thank you.
One is ivermectin safe for those with kidney and liver issues? How do you treat children? What is the impact of zinc on infected persons? And can you explain steaming and share contact information for participating doctors? Those were the common questions.
And I have to layer them for me.
Yeah.
One at a time, and I'll let
Steam.
Dr. Hayman. Oh, steaming. Okay, that's my. But I love that one. It's no like Listerine, like alcohol, hand sanitizer, etc. The virus does not like extreme heat. Certainly above 60 degrees Celsius, it dies within a few minutes, and certainly does not. You don't grow the virus in the midday Jamaican sun. Yes, you can pass it on. Yes, you can still get it. But steaming is really about increasing the temperature to weaken the virus and therefore improve your immune system. Unlike Listerine, gargling, and brushing of your teeth, steaming gets a lot further, deep down into your lungs, into your sinuses. And that can help to loosen up a lot of exudates, a lot of phlegm inside your lung. And we found that that's very helpful in terms of clearing your lung and improving your oxygenation. So steaming is very, very effective in improving oxygen concentration in your blood or your oxygen saturation. And certainly for me, myself, when I steamed with a saturation of 79%, and you will agree with me as well, that when you steamed, you saw an immediate improvement in your oxygenation, but not only that, that correlated with how you felt. You felt a lot better. So steaming is very, very helpful. And in my mind, I'm pretty much settled that steaming works based on the number of patients that we've treated. Steaming is very, very effective.
The other one is how do you treat children, doc? And is ivermectin safe for those with kidney and liver issues?
By and large, children have had an unfair price to pay in this pandemic. The treatment of children is largely very, very mild, minimum symptoms. Now, I do agree that this Delta variant is seeing a bit more children being a bit unwell, but by and large, children have not been killed in any significant numbers by this virus. So the treatment of children is reassuring, simple oral hygiene, steaming, Listerine. That should do the trick for most children, and plus or minus some Panadol. But it doesn't require a lot of intensification of management. Now, there are some categories of children, for instance, those who are sicklers, diabetics, obese, they may require antibiotics and steroids. But by and large, children is simply symptomatic treatment, close observation, and then saturation. Leroy, you want to add to that?
Yeah, I mean, the children I'm seeing who are positive, those between the ages of, say, 5 and, say, 14, they really have very mild symptoms. So, as I said in my introduction, when we do their risk assessment, we just put them on maybe mild anti-inflammatories because the virus does cause an inflammation. And so we put them on mild anti-inflammatories like Panadol, but we also monitor them to make sure that they're not developing a severe infection. But the cases I'm seeing are very, very mild and require only mild anti-inflammatories like Panadol. And of course, we don't recommend steaming for the young ones because of the risk of burning themselves. So we tend to stick to the oral hygiene and encourage them to do breathing exercises to help get rid of the virus. On the question of zinc, zinc, as we know, is an immune booster. It will build your immune system. It will strengthen your immune system, and it will give you a better protection. So that's why we recommend zinc supplements. The dose of, on the question of ivermectin, the dose of ivermectin we use is really very low. We use 0.3 milligrams per kilogram. So if you are average adult who weighs 70 kilograms, that would be 70 times 0.3. That would be work out to about roughly 21. And so we give you that in 2 doses. We give you one as a start dose, and then we repeat that 2 days after. So its effect on the liver and kidney is very, very minimal. If you have liver and kidney disease to start out with, we'll be very cautious in doing the appropriate lab tests to monitor you to make sure that they do not deteriorate if you have that as an existing condition.
Thank you.
Hello.
Damien, thank you. Welcome, Damien.
I'm finally able to get through.
Thank you.
But
Let's hear.
things
Let me just say something, Damien. Damien is in your 40s, mid 40s. Pretty much live alone, and he's a diabetic, and you'll perhaps agree with me, slightly overweight as a male. So
not anymore.
I want you to tell me your story, my brother.
Okay. Good night, everyone. Yes, part of my thing was diabetes, the obesity, as well as asthma. In around March this year, for those of us who are diabetic, I'm not diabetic, asthmatics, we know when something is coming on and something is not right with the chest. So I went to my doctor. It was said that I was having an upper respiratory chest infection. The Curam, I think, was the antibiotic that was prescribed for me, along with some other things. And after taking the antibiotic for over a week, there was still no change. Still felt irritated, itchy chest type of a thing, shortness of breath, all of that. And that's when I decided, all right, let me get some alternate, advice. That's when I contacted Dr. Hunter. He went through with me as to what was, I went through with him as to what was happening. And then he, over the phone, spoke to me about what I would need to do, as well as gave me a prescription with all the indications, or instructions rather, as to what I need to do on getting the medication. So the whole thing of the vitamin and the ivermectin and the antibiotics, as well as I had mental crystals at home, so never needed that. But it was on starting to take the medication that he prescribed, and based on his instructions as well, that I really started to feel better. I particularly in the steam inhalation. That in particular was very, very helpful. It freed up my chest, wasn't feeling that lethargic anymore. So I could feel the change, that itchy, irritated feeling that I had in the chest, upper chest region as well, went after a while. The whole thing of doing the gargling with the Listerine, and I did the whole 9 yards, after about 2 weeks, I started to feel real better. The last thing that left, and I don't know if it was because I'm asthmatic, but the last thing I really had to deal with was the just the chest on and off. Sometimes you're breathing all right, sometimes it feel a bit funny, sometimes it feel a bit itchy. But I persisted with the steam inhalations, and that was what basically got me to that place of really just feeling okay, you know. But it was an interesting experience, I tell you, you know.
How did you feel a point of impending death? But say before the steam, or did you feel like you just
At
couldn't
one
carry
point
on?
I was beginning, I had thoughts of that, but it would be because the chest wasn't clear. I never, it is interesting though that I never heard much wheezing, because sometimes you can hear the wheezing. What it just felt like was like something heavy was on my chest, right? That prevented me from getting all the oxygen I needed, you know? So at times I had to prop myself up. Thoughts of death did come, but I pushed past that and simply did the.
I'm not blowing my own trumpet, but just to say, how important is it to know that you have access to some reasonable medical knowledge, or some, how did that make you
It's
feel?
important because I remember when I booked upon things that I never too understand, I would text you and or call you and you taught me and say, all right, do X, do Y. So it does help. It does help. And living alone, you need that type of a coaching sometimes to just get you past, that obstacle. So for that I'm grateful. Yeah, yeah, boy, you went above and beyond. That's all I'll say.
Well,
No, you know what
quite
you did.
humbling. That's quite humbling. I mean, I know Dave and Hotet for probably 40 years now, and he was one of our great drum majors at Jamaica College, a drum major with a 4-star chevron. And to hear that Joseph was actually 46 years old, obese. No, I wasn't prepared to hear another statistic, and we did what we had to do. And so intervention early at home works. It's over and over. There are so many cases. Sometimes we'd like to do studies, but when your phone rings every second, you have to treat the patient and then do the study afterwards. So it's likely our learning will be experiential, retrospective, but this platform is actually evidence itself, it's witness. And I brought patients in here to give you primary witness as to what actually early home-based treatment does. People with significant comorbidities, Roxanne Silence, who spoke earlier, she had no less than 7 comorbidities. And that's why her outcome was deemed to have been definitely going to be negative. But she passed through, she passed over at home. That's because we had early home-based treatment. Chairman, Mr. Leroy, you want to add anything to it at the moment and to that conversation? Leroy? Okay.
No, not at this time. Let's we can move on to the next question.
I may have had one more question.
Okay, Priscilla?
Please, I had one more question.
Okay, go ahead.
Real quick. Yeah, I was wondering, because, we've been hearing this a lot. Is it a myth that the vaccine is like an artificial immune system that is implanted in us to fight the virus? What does it really do? What is a vaccine?
Leroy, you want to take that one?
This forum is not about vaccine and vaccine myths, but no, I don't agree with that. The vaccines are given to stimulate your immune system. In other words, it stimulates your production of fighting mechanism we call antibodies to protect you. So whichever one they use, either the viral vector or the mRNA ones, that's the purpose of it. The primary purpose is to trigger off an immune response where that response protect you from getting a severe infection from the virus.
Okay, thank you.
Okay. I
Christopher
saw.
Hunt, so we have a Christopher Thomas from the cleaner.
Lovely. Yes.
You could take his question.
Hi, good night, Doc, and good night to everyone else in this forum.
Good night, Christopher. Thank you for being here.
Yes, sir. Yes, thank you very much. My question has to do with the whole issue of possible alternative methods of treatment, because you've spoken about early treatment, home treatment, but what about things like the use of herbs and plants and such?
Oh, wow.
For that kind of.
Okay. For me personally, I certainly know that herbal traditional medicine, so to speak, I would elevate it to that, because it was the medicine before we had big pharma. They definitely have a place, but we unfortunately we are victims of our training. For the past 100 years, doctors like ourselves have been trained a certain way, and herbals and nutraceuticals, herbal medications were not a part of our curriculum. So we become like the lay person in society whose knowledge of herbals, because it's really like what you hear from patients or your family or your loved ones. So we can't recommend any particular herbs. It's just that I can say definitely patients tell me all the time, well, doc, I just drank this particular tea, be it mint tea or some, I can't even pronounce your names, and it made a big difference. So I would definitely not discount what you're saying, that herbal treatments definitely have a role in this. It's just that I want you to not stay by yourself. I want you to tell people that you're taking herbal treatments. I want you to tell people how you're feeling, because even if it's traditional medicine, you need to tell people how you're feeling, because if you're not getting better, we need to know. So early home-based treatment is underpinned by early home-based monitoring. And to monitor whether you're taking herbals or tablets, you must have a pulse oximeter. This little thing here, because you can't say how you feel. My SAT was 79. I didn't feel short of breath yet. When I did my oxygen reading, it was 79. That's how I knew. So you must have monitoring if you're going to go the herbal route or the traditional or the modern medicine route, for want of a better word. Okay. You want to have another question?
Yes, actually, I do. Just to follow up on something that you said during your own presentation earlier, where you before you spoke about the need to set up a therapeutic helpline. Before that, you had said that there's a bit of a failure to understand the health sector as it relates to bringing in of retired nurses. Do you think that our esteemed health minister is going to take very kindly to that kind of argument or criticism?
I don't think I said bringing in retired nurses. So you have to bear with me. It's a long day. I'm not sure I encroach upon what nurses should be doing. I'm not sure if I said that in particular. But I think it's without doubt that these are not ordinary times, and we must bring in all resources. Remember, the health system is not only owned by government. Well, it starts with you, the individual, and taking personal responsibility for the health. If you choose to go to the government services, then you would submit yourself to that type of care. But where we see the health system, as government plays a huge role in the health system, and a lot of people rely on the government provided health system. As it stands now, it is obvious that the government health system is struggling. We see images on the internet that people they don't have beds. We see other governments reaching out to doctors in retirement to come back in. And we humbly await the call from government to reach out to the independent public health providers to help them deal with the COVID crisis. The stories that you're hearing and the testimonials are largely from patients who are treated in the independent public health pathway that is outside of government. Remember, health for the public is provided not just by the government, but by independent practitioners, those who are not constrained by a government contract. So it is something that we can honestly say to you that, for instance, ventilation is not the best way to treat COVID. We can say that pouring millions of dollars buying a lot of ventilators is not necessarily the best spend. The best efforts need to be focused around early home-based treatment. Now, the question is, does the government service have any particular approach, any algorithm, anything to offer to their patients who, for instance, are turned away from the hospital? Have we heard on a public forum where patients are told, stay home and treat? And when you treat in this way with this particular drug, with that, and then you also monitor. And correct me if I'm wrong, but I don't think you'll see that in the government's plan. The government's plan is largely around stay at home and watch. And when you go to a certain stage, you then come to the hospital where they will treat you in hospital. But we recognize that hospital treatment is not the best treatment for COVID. And you've heard testament after testament from Roxanne Silent, from Damien Joseph, from Raquel, from so many, Celia Jackson, and compare and contrast people who had hospital treatment and those who had home treatment. So it's really a call for learning, for shared learning, that authorities listen to what's happening in the independent public health pathway and see how that can better inform government's approach. So it's not a criticism, it just speaks for itself.
All right, thank you very much.
You're welcome. Dr. Alon.
Good evening.
Yes, thank you. Good evening, everyone. Yes, I have been. Thank you, Dr. Hunter. I have been patiently waiting for my turn.
Wonderful. Thank you for joining us. Are you a medical doctor or a dentist or a PhD?
A PhD.
Lovely. What? Okay, thank you. What's your area?
Dr. Phillips was my student at NCU.
Oh, amazing. Thank you. Thank you for giving us an amazing, a wonderful dentist. Thank you.
Thank you very much. It's a pleasure. I must thank you, Dr. Hunter, for the excellent presentation. Every single presenter, you all did very well.
Thank you.
I didn't come here with a critical eyes. I came here to learn. I have been crying. People have been praying and say, Lord, there is something that we need to do as a nation. We can't be telling ourselves exactly what you just said, Dr. Hunter. I agree with you perfectly. That is excellent response. We needed an alternative. What do we do? What do we do? Should we just fold our hands and die? Should we just say there is no hope? Coming down here, you have given hope to so many. I shared the link when my colleague shared with me. I shared with so many persons and I know they are here. So I want to really thank you for the hope you have brought, for the prayer that has been answered. And I tell you, many persons will know this. My question therefore is, why will our government, our leaders who are there to save life, elected to protect the population, why are they not allowing people like this excellent group, intelligent Jamaicans, willing to save life, willing to help, willing to assist freely, genuinely, sincerely? You're not giving them a chance? What are we doing? We're going to look for people from Cuba to come to us? When we have people with open hearts, everybody on this platform would have learned, and I want to beg you, and I pray for you and your team that the Lord will protect you. No weapon formed against you shall prosper. The Lord will keep you and your family together in safety, every single one of you that are working together as a team, because the lives you have saved, God Almighty will reward you. He will save your life no demon, no darkness, no occultic power, no political power will be able to stand against you in the name of Jesus Christ of Nazareth. Amen. So I just want to thank you.
Amen.
I really appreciate you. This is where my heart has been right from the pandemic. I'm a microbiologist. I know immunology.
Lovely.
I see what is happening. I know what is happening. I understand everything. But with my God-heartedness, I couldn't just drink and dream and eat all of the garbage they were throwing at us. So I say, God bless you. Thank you so much.
Thank you.
Amen and amen.
All right.
Amen.
Amen. Amen to that.
Bless you, sir. For your blood coverage over your life.
Amen.
Thank you. Bless you.
Praises,
all.
praises,
Gonna be
praises.
COVID champions. and COVID
Amen.
Amen. Okay, let's move on.
Bless the Lord. Moving on to Ethne.
Roger, if I may make a comment before we go on.
Thank you.
Yeah, I really appreciate those kind words from Doctor who just spoke. There were words of inspiration, but we need to understand that, you know, I can't speak for the government. You Roger, can't speak for the government, but their main focus right now is the vaccination, and we understand why. They have this drive to vaccinate as many people as possible because, as I said before, it's real. The reports, the data is showing that once you're vaccinated, if you get the virus, which you can get, you're going to end up with a mild infection. But you see, as I said before, we organize this forum. So we have been in the news, we have been presenting this information for a while now, maybe over 2 weeks since I know our organization of getting this knowledge out, and many people have come to us, and I mean, many people have been prevented from going into the hospitals, but we really need this message to go across the nation, because as I said, we are trying to reach out to the people who are getting sick, the people who, when they go to the hospital, they can't get the treatment that they require, and many end up dying. We feel it so much when we heard in the news yesterday that 30 members of the legal profession, passed on because of COVID. Yesterday, a high court judge passed on, and we wonder if we had got him in the first 6 days, you know, what would his outcome would have become. So for all the influential ones who are on this media, if you can help us to get this message across the land, boy, it would be our joy to see people getting better. It will be our joy to see less people going into the overwhelmed, crowded hospitals. And it will be our joy to see less people dying in this country. So those of you who have high influence and you can get this message to the government, we really need them to endorse what we are doing here. And so more people can be saved, more people can get better faster. Thank you.
Thank you, Mr. Chairman. Ethne, have you a question?
Thank you. Thank you so much for having me. So my question is this, or my my recommendation. I'm not in Jamaica, so I was invited to listen, and I am so happy. But I hear you all talking about the protocol and the steaming and the everything. But what could I ask? Could this be like packaged in a booklet, or could it be? Is there a website where I could access the protocol, where I could say, okay, I'm going to get item X, Y, Z. I'm going to steam every day in case my elderly parents live with me. So in case, you know, I need to put them through that protocol, what are the steps to take?
Okay,
and where can I access this information?
361-2686. You WhatsApp me and I'll share it with you. 361-2686. Medical Strategist has kindly provided a algorithm which we've also shared with government hospital. It certainly was it was a pleasure to share with a government hospital at 3 o'clock one morning when they called and asked for a protocol because they didn't have any. And we have not just government hospitals, we also had other hospitals where we were able to share our protocol. So if you WhatsApp me, I can share that with you.
36, could you repeat the number for me, please?
361-2686.
Thank you.
All right. Galaxy S6. Galaxy S6. No. Can you unmute yourself? Galaxy S6 Edge.
Seems like the person is not on.
Miss Allen, can you go? Miss H. Allen, can you go, please?
Yes, good night. Good night, doctor, and all the other doctors. Thank you very much for the information. Okay, I am B positive, so, but I eat a lot of chicken, and apparently when I eat chicken, my blood coagulates. And I recently found out that my cholesterol level is a little bit high. So, and because I know the COVID vaccines sometimes give you clotting, I am fearful of taking it. Is it safe for me to take it with this
Certainly,
condition?
it's one of the contraindications. It's one of the things, especially with the AstraZeneca and the J&J vaccine, that thrombosis was noted. So if you are particularly predisposed to thrombosis, but not only the vaccine as well, COVID disease induces thrombosis. So what I would say first and foremost is to treat your underlying condition so that your risk of thrombosis comes back down to normal. So for instance, if your cholesterol is high, that should be corrected before taking the vaccine. So if you have a cholesterol of 9, 10, you really shouldn't be vaccinated until your cholesterol comes in a normal range. Or if you have other conditions that put you at risk for blood clot. So definitely you want to fix your underlying conditions, not only for the vaccine, but also for COVID.
Okay, one more thing too. I'm also allergic to penicillin, and I saw that question. Is it safe for me to take the vaccine if I'm allergic to penicillin?
Well, allergies have become an issue that if you have a history of multiple allergies, then that's a factor that you need to be careful of. And so I'm not sure the specific, what it says about penicillin allergy. Maybe an isolated allergy is fine. But if you have a history of multiple drug allergies, not just penicillin, but others, then it would be careful of you to, you know, perhaps seek very good advice first before advice. But multiple allergies is a contraindication to vaccination.
Okay, thank you so very much.
You're welcome. Anne-Marie Trowers.
Galaxy X6 is ready when you just had a hard time unmuting, so I'll wait.
No problem. Galaxy, go ahead, please.
Okay, great. Thank you so much. Good evening, everybody.
Good evening.
And this has been such an I was on this the second one, and this is just as good. My question is this: I have had 2 persons I know. Well, one of them passed away, and they were in the public hospital. One of them is still there, and they got prescriptions with things that they could not find in Jamaica, and were actually told that this medication would cost them up to $300,000. They're in hospital. Their family members are all over the island trying to get it. At one point, one of the persons, they eventually found the medication in Mandeville. By the time they called back up at the particular pharmacy, they were told that the medication is no longer available, and the pharmacy was actually going to order, but they're not going to order again. One of the patients died. The other one, I got a report today that that one is not doing too badly. They hadn't gotten the medication. I don't know what they are using. So my question is this: I'm wondering, what are we using the public hospital, and how can we have patients in our public hospitals that are expected to source medication for $300,000 that are not even available in the island? It just boggles my mind. And then I don't know if any of you can answer. Any of you doctors are serving the public. I know you have your private practice, but I just cannot understand what is happening.
Let me just make it absolutely clear so far, and this is probably just my view.
Yes.
I just want to say it very clear that the word public is not owned by the government. It's just a service that you supply to the general public. The government provides public service through taxes. We provide public service through direct fees, or we choose not to charge. Sometimes you choose not to charge for your service, but it's still a service to the public Private
Right.
service is like, well, it's only my friends and my family can access me. So we don't just make that very clear. So yes, we may not have a government contract, but we
Yes.
serve the public. And if
Right.
we see people dying, if they have been turned away from elsewhere, we're not going to turn our backs on them and not help. And as I said, we use this forum that we are willing, we stand willing to help the government of Jamaica in fulfilling one of its mandates in delivering public health care. We stand willing and able to share our learning and to learn from them in the better interest of the public. So we hope that those who are close to government are hearing this forum and seeing the shared testimony that this is not a political statement. It's a national statement for the interest and advancement of every citizen, every resident of Jamaica.
Right. So
lobby your MP, in other words.
Well, lobby the MP. Okay, because okay. Thank you very much.
And all the structures that go into government.
Okay, great. Thank you. Thank you. I was trying to get to one of the calling programs to see if it, but it's just so difficult. I thought
But
that
you
I
have
was
to, you can't give up because you know what is at stake.
Pardon me, say that again.
I'm saying you can't give up because a lot is at stake.
Exactly right. I'm not going to give up because it is crazy. So thank you very, very much and God bless you all.
Thank you. Anne-Marie Chowers.
Yes, good night, everybody. Just wanted to ask the question about the positivity rate that you spoke about earlier, approximately 50% now. Is that fair to say that's representative of the population? I'm thinking that that positivity rate would be persons who may have come in and may suspect that they have COVID, so they may be having symptoms, and maybe when they're tested, you know, they're 50% of that population. You know, it's COVID positive.
Brilliant question. In other words, it's focused around the symptomatics rather than the asymptomatics. And we know 80%, perhaps as many as that, are asymptomatic. So your question is rightly grounded, that it's probably a higher positivity rate than that.
Right.
You're not testing the asymptomatics, which are, we know, are positive and they go around totally fine. The slimmer you are, the more you look like Major General Anderson, the more you look like Juliet Cuthbert Flynn, the more you're likely to be asymptomatic and probably go on the radar not tested.
All right, the next question, right, is the new Delta variant. I don't know how much of it the private doctors.
It's an inevitable variant.
Right, but I'm just saying that in terms of your protocol, will doctors have to change maybe what they're doing now, given that the symptoms maybe different, diarrhea?
Yeah, the doctors have to expand their working diagnosis and suspicion to do a test and to treat. Yes, yeah, absolutely right. But let's just be clear, this virus will continue to mutate. And the Delta variant is not new. It's new to the extent where we finally got the results after 3 months of waiting from Trinidad. You have to wait 3 months because Jamaica, again, though we spent $12 billion trying to isolate coronavirus, we are struggling to find $60 million to get the equipment to type our viruses and our variants here in Jamaica. So there's a bit of, because you want to know when a new variant emerges, and you can call it Delta, Lambda, whatever you call it, but you like to know because you then pattern to see how it behaves. But I reckon the Delta variant has been with us probably at least 3 months, 4 months now, or longer.
Wow, so it's on the loose long time.
Yes, and we've been seeing it. A lot more people are becoming sick, but it's just now it's more intense. So has it changed again? Have we now to sample now and send this sample off, and we'll get this result in another 3 months.
3 months, right? Oh boy.
By which
Thank
time
you so
the
much.
virus changed again. So it's
Right.
really on the back foot. We really need to get our own equipment. Mike,
right, so we can have a quick response. Thank you so much.
You're welcome. Michael Muir. Michael Muir, go ahead.
Good night, Doc. Thank you for sharing. Wanted to address the elephant in the room. Several people posted in the chat about Israel being 80 to 85% vaccinated and having a breakthrough.
A third booster.
And we're told that they're going to have a third booster.
No, they have it already. They had it already.
Right. So I'm hearing that they still end up in hospital, whereas you are advocating for for early
Early-
treatment
early
out of
home-based treatment.
hospital. So I'm not sure if we are totally encouraged by the prospects of the vaccine.
We
Would
again,
doctor-
we welcome the vaccine. We encourage, we recommend it. We don't agree with mandating it, but it is very clear. When you look at the United Kingdom today, 150 people died, and United Kingdom is practically a fully vaccinated country. So we know vaccines are not the only answer. They are part of the arsenal, and we recommend it and endorse it. But if you only apply vaccination, people are going to die in significant numbers. So you need to turn your attention to early-based treatment and look at the outcome of independent public health providers. And we are saying to everyone has lived. People with significant diabetics, obese, with hypertension, with multiple comorbidities. So they're not easy patients. They're not mild categories at all. Saturation of 70s and temperature of 103. If we can intervene and they, by God's grace, are alive with no death, then clearly there needs to be shared learning and people need to listen to this. So yes, the vaccines are welcomed, but as you have pointed out, there are limitations to the vaccines.
Yeah, I was just trying to do my logical deduction based on what Dr. HAYMAN said, I think it was, that the vaccine stimulates your own immune system.
Yes, that's how all vaccines work. In
Right.
fact, vaccinations were brought to the North American context, not by the but by our forefathers, an African slave at the time. I think his name was Onesimus. And I think that was a smallpox or cowpox, and he had learned it. He was quite eloquent and well trained, and he was literate. So he was captured and brought over, but he introduced the vaccination, and they're now recognizing him. So the vaccination hesitancy came about perhaps from the Tuskegee experiment and the distrust for first world systems, but it's not new to Afrocentric races.
Yes, but also from the fact that we are also being exposed to the suppression of information such as what we're sharing tonight. That's one of the reasons for distrust. Secondly, if the vaccine simulates our own natural immunity, why is it then that we're saying that after 6 to 8 months, it loses its efficacy? Aren't we supposed to be now relying on our immune system to do the work?
Yeah, so the truth
Are we
is,
going to be perpetually
truth with
encouraged-
vaccine, again, remember, you know, you have to get boosters like tetanus and chickenpox and other vaccines that you have to give them boosters after 10 years. You have to get a booster. Just that with the seasonal respiratory illnesses like coronavirus, that booster has to come a lot more quickly because the immune response that's triggered is not sufficient to protect you against the next version of the virus. So for instance, the flu shot has been around from 1930. It still is following behind the influenza virus. It hasn't caught up. It constantly changes. So the vaccination within the respiratory illnesses tend not to be as long lasting, but it reduces hospitalization and death. So it's certainly something that we'd recommend.
I think so does your treatment. It reduces hospitalization and death. So
this is what the focus of the conference is. We're saying open our books, 100% live. We hardly have anybody on oxygen. We tend to practice more of permissive hypoxia rather than reacting to a SAT of 71 and say, oh my God, no, we tell the person to steam, list to keep calm and deep breathe, expectorate, that is to bring up stuff down there. And with that alone, we've seen it all week after week, that brings your saturation up without oxygen into the 90s.
Okay, thanks.
You're welcome.
Doc, in the
Another
chat,
thing,
yeah.
Before we go on, and in answering to that question, another thing we need to bear in mind is that our own immunity, our natural immunity, there's a lot of studies that it also wanes, it also decreases with time. And there are also studies to show that it might not be protective of, again, some of the variants. So you can't rely also on the fact that you get the infection, you have developed your immunity. You can't rely on that also, because that also wanes with time. Studies are being done. Some say three months, some say 6 months, others are saying up to a year. We don't know, but that's why we have to believe in the facts that yes, even though it's the protection is declining with time, if you take the vaccine, which also declines with time, then you will get a milder infection. So this is why we keep promoting that in spite of all the other measures, we have to take the vaccine.
In the
Okay,
chat, there are a lot of questions about sicklers. Should sicklers be taking the vaccine versus with sickle cell?
I would think so. Yes, the sicklers in particular have had a burden. We know that they're already predisposed to the crises, and the coronavirus would trigger greater crises. So I would suggest that once they don't have corona infections, that they should also be looking to take the vaccine. iPhone, get your question. iPhone, no. Garth Stewart, see next.
Sorry, good night, Dr. Hunter, and all the guests here on this panel.
Good night.
I have after hearing all these stories, I guess I should be, well, I am grateful for my experience that I had with COVID-19, right?
Okay.
Repeat that for me.
Tell us, great. I mean, I'm glad for you.
All right, so I caught COVID-19 last year, August. Last year, August, I would say the government was still trying to get a hold on the entire situation, which I think they didn't have that hold on it. How it started for me, it was basically like I didn't have any taste or smell, which comes with, coming down with the flu. So I basically had expected that I'd be having some sniffles, maybe about a day or two after not being able to taste or smell. But I think like about after 3 days not being able to taste or smell, I still, there were no sniffles. So I decided, no, man, it's kind of strange, because if I was coming down with the flu, then, that would be coming up already. So then I decided to visit my doctor. So when I went to my doctor, she said, I don't think it's really COVID you have, because, you seem to be all right. But when she had checked my chest area, I had a mild infection there. So what she did, she had prescribed some antibiotics for me, and also some turmeric capsules along with it, and took the COVID test, and, asked me to stay home for a few days until the test would come back. At that time, the test results basically took almost 2 weeks to come back from the government lab. So when it came back positive, but that basically was the only symptoms I had of the COVID-19, just not being able to taste or smell. And after taking the antibiotics along with the turmeric capsules, because that's basically all I did. I didn't drink anything cold. So it would either be warm to room temperature. So if I'm even drinking some water, it would have been room temperature. So that was basically my interaction with COVID-19. Even after that, I even had donated some antibodies to the university hospital, even after that. But my main question is, Dr. Hunter, because you're saying that before doing the vaccination, to do a test to see if you probably have the virus or anything like that. But what if you did not do that test and you took the vaccine? How long, say for example, if you would have, just saying, if you would have had the virus, but you're being asymptomatic and you took the vaccine, how long would it take for any form of reaction to the vaccine if you had the virus and took the vaccine?
Perhaps not very long, within a week. And we had a very prominent journalist who was a clear demonstration of that. So not very long at all, the virus stimulates the immune system and the vaccine stimulates the immune system pretty much right away. So it's not very long.
So if I take the vaccine, say for example, probably about 2 to 3 days ago, then there would be some sort of reaction already to my body if I had the virus and took the vaccine.
You need to be about 3 weeks clear of either, minimum 3 weeks clear. 3 weeks clear between the two to have some relative safety.
Oh,
3 weeks.
okay.
So 3 weeks, you took the vaccine 3 weeks ago and it got infection a month later. Maybe not bad, but if you got infection within a week or two or within 3 weeks, that's a higher risk of excess stimulation. All right, we're gonna have to move on quickly because I'm being given the wrap-up signal by my chairman, my co-chair. So I know this is a very popular meeting and we do promise to do it again. It is up, there's a need, there's an appetite for it. I want everybody in this room to be COVID champions and COVID competent. And we're gonna have it again, perhaps not next week, but a week following. There is an election running that's occupying my time. We hope we're successful, but at the same time, we have a duty, a national duty to ensure that every Jamaican, every citizen of Jamaica has an idea of what to do in case they in case they or their loved ones or friends should have COVID right now. Carice Lawrence, next one.
Yes, good evening, everyone. Once again, thanks a lot to the doctors, who are doing this mighty work, and to everybody who has been sharing their thoughts. I had also posted my question in the chat, and I'm just checking in if the doctors have any official data on side effects of being around persons who have recently been vaccinated. I've seen information online about adverse effects for women regarding their monthly cycle. I've also seen regarding fertility issues. And I know that I personally had an experience a few months ago where from my teenage years, I've never had a moon cycle that has been off with its timing. And for the first time, I had my cycle 2 weeks in. And when I was observing and looking back at the only thing that was different, all I could come to was that I was around somebody who was vaccinated. So I want to know if there's any data on these side effects, because as you know, the fertility issues are primary for women.
To the best of my knowledge, I don't know of any case where because you're vaccinated, you sat beside somebody who was vaccinated, that there's some particular transmission of something vaccine related to you. The Ministry of Health has indicated there have been 2 deaths that are being questioned in relation. I don't know if they have been settled as relating to possibly vaccine deaths. Internationally, they have definitely recorded vaccine deaths. But this forum, again, is not focused on the vaccine, and we may have to do a forum specifically on the vaccine. But we are focused on early home-based care, home-based treatment on an early basis. So we'll have to have a discussion amongst the early home-based COVID treatment group to see if we could facilitate a more thorough discussion around the vaccine. We recommend the vaccine. At this time, the evidence to mandate it is not there. But in terms of particular detail of vaccine complications, we certainly refer it to the Ministry of Health. I think Zara Burton also wrote an article on vaccine-related complications in Jamaica. Perhaps you can also speak with her. All right, but we're gonna have.
We have time for another question.
Yeah, DL3, are you back in line?
Hello.
Go ahead.
Hello, good evening. My name is Dwight. I have been a silent promoter of ivermectin, and I have a quick question to the doctors on the panel. What is your take on ivermectin in use as a prophylaxis agent?
answer quickly. Yes, we recommend it. We have got an excellent experience. Leroy, what's your experience with ivermectin prophylactically?
Well, in my practice, I don't use it for prophylaxis. I use it for therapy, for treatment. So I wouldn't recommend it because, I mean, you're gonna have to keep on taking it day after day, day after day, week after week. And because this virus is gonna be around for a long time, how long are you gonna take it? So for that reason, I don't recommend it. Full
It is
stop for
stated
that
that it
purpose.
stays in your system for 2 weeks. Some claimed a month based on some early studies. So it's not something that you take daily.
Right, I know. There are various regimes out, but what I'm saying is that with the virus being around for a long time, you would have to keep on taking it for many days to come. So for that reason, I don't recommend it full stop because the chance of getting side effects is gonna come in, and especially damages to your liver, kidney, maybe the gastrointestinal.
Even at low doses.
Yeah, but low doses, no, I wouldn't endorse it at all. I wouldn't on a forum. On a forum like this, I would not recommend it.
It's something we'll discuss.
For that purpose, for prophylaxis.
If we would have.
But you realize there are studies out that promote prophylaxis at 6 milligrams.
I'm aware of it. Yes.
Yes. Okay.
I would use it. I've used it prophylactically. I'm just telling you, not everybody sees it in that view, but I've used it for a month and patients are okay. But Hayman's question is quite right. Do you do it for 6 months? Do you do it for a whole year? And you know, there's a lot of hysteria in the air. So you're gonna run into the zone of complications, liver, kidney, the longer you use it. So it's a balance. And you just have to say, when are you?
What about prophylactically on the risk of exposure? If you think you have been exposed.
That's how I use it. Like if you've had somebody in the home had COVID and you want to try to remain COVID free apart from the other measures, I've used it for like 3 weeks.
And you know, it's not arbitrary. It's according to kilograms body weight.
No, we're not talking about the dosing. We're talking about the use in terms of prophylactically. It's usually a weekly interval, but the dosing depends, of course, you're right. Depends on the patient size.
Well, there are studies out there that it is not indicated or beneficial in mild cases. That's why we assess your risk when you come to us. And based on these studies, now what I would really love to do, boy, is if we can really find the time and the money to support a study, is to look at it now in the moderate to severe patients. But usually with what we're practicing here with the non-pharmacological methods that we're suggesting, I mean, chances are there will be no use for the ivermectin, definitely in the mild cases. And if your risk is high, that's when we give it to you. And then we're seeing that your outcome going into the second week of the infection is much, much better than if you didn't take it for the high risk patients.
For the high risk patient.
Yes.
All right, we're gonna have to move you on. This is a treatment focus group though, rather than prophylaxis or vaccine, which they come under the same thing. So we want to keep focus on treatment. All right, thank you. We'll pick up ivermectin at another conference. Thank you. Question, DLS?
Very heartened of this forum. Thank you very much.
Thank you.
Question was on the oral hygiene.
Excellent.
What would we be able to rinse our toothbrush seeing that the bacteria is so high in our mouth with hot salt water?
Yes.
Or warm salt water to rinse it, whether on a daily or a weekly basis?
But yeah, that's true. But I would perhaps, but remember the toothpaste as well would also do the trick once you rinse it off. But you're gonna need your
question is whether do we have to see that we should brush after each meal? Say for example we eat 6 times for the day, whether snacks or otherwise.
Yes, that's
do
right.
we need to use toothpaste at that time?
100%. 100%. Brush after each meal. So if you're diabetic who has to take a lot of meals throughout the day, you have to brush after each meal and brush your tongue as well.
I'm asking if we should use toothpaste at all times.
Yes, when I said brush, you have to use toothpaste at all times.
Okay. All right. Thank you.
All right. Thank you. Alicia Chen. Alicia, can you unmute?
Good night, everyone.
Good night.
Thanks for having me. It's very refreshing to hear all that has been said. My question, another question. I had the COVID. How soon can I take the vaccination?
I recommend, according to the WHO, 3 to 6 months. If you're conservative, you go 6 months. If you're a little bit more bold, I'd say 3 months, but not before.
Okay, all right. So if I was, let's say I've got my release letter from about the 15th of June, could I take it at the end of this month?
Count 3 months and wherever that leaves you. So if you're very hawkish, sure, 3 months. If you're more conservative, 6 months, wherever that mathematical period lies.
Okay, then. Thank you.
You're welcome. Maxine McCaw.
Yes, good afternoon or good night.
Good night.
Say thanks again for the forum. I was at your last webinar and was impressed and invited many people. However, I don't see my question that I put in the chat, so I'm going to ask it quickly. Or I'm a little confused because the early treatment, which I really promote a lot. We have had our own incidents in my own family, and we have promoted always early treatment. And but your early treatment seems, from what I'm hearing, has almost 100% recovery.
No, and that's not what you're hearing. 100%, not almost 100%.
Ah,
100%.
Oh, so that's even better. So you have 100%, and some of them may have gone to
104-year-old lady.
Right, and some of them may have gone to not as much as just gone, not many with being critically ill.
Well, the hope is to stop them from graduating to critical illness.
Correct.
Breaking the chain. We get you early. As I said, on Monday night, I had a patient with a temperature of 103. He was delirious, talking awesome. So we had the family up all night, sponging him down. His temperature was 98.8 in the morning, sitting up and having breakfast.
Right, and I sure that has happened, because we have seen that in evidence in our life, in my family's life, what we abroad. But my question is, should we as a forum, I know that the vaccination is important for many people, because the majority of the people who get vaccine, from the reports, seems like they will not contract, they will not that they won't contract the virus, but they won't go to the hospital. Now, your early treatment is giving me that same thing. That early treatment is not going to let me go into, don't have to let me go to hospital or be critically ill or die, because from your data, no one has died as yet. Yeah, so my concern and my confusion is, why can it, therefore, why should we encourage mandating for the vaccine, encourage what do you call it, discrimination because you don't take the vaccine, when I can do early treatment, as I've had 2 members filing who did early treatment and they were negative by this 8th day. And we have had that. We are also very, our immune, we also do not eat a lot of the stuff. We believe a lot in nutrition. So I appreciate your answer to that question, why we don't use a little bit more herbs. And I appreciate it, because some doctors will just say, oh, they're no good, they don't have any place. So my question is really, why can't we do early treatment also as an alternative to the vaccine? I don't, if people don't have a peace about doing the vaccine, but they are discriminated on, they are being called 10 times a day to say, make sure you go and take the vaccine. So you're pressured by it when you know that early treatment can also help. And from your data, it seems so that that can happen.
Well, and the testimony that we have tonight, it's happening. So we recognize that the government needs to be a part of this discussion, that health is not only owned by the government, but also independent practitioners, and of course, down to the individual person. So again, we are all COVID champions here, and in being champions, you become advocates. So reach out to your representative, reach out to the airways and ask them, why can we not have a program of government administered early treatment? All right, thanks, Maxine. We're gonna move on.
Okay, thank you.
GS. GS.
Yes, present. Very good. Thank you so much for your honesty and the expertise and just giving alternative. My question is the virus a natural occurring virus or is it synthetic?
We're going to answer this one quickly. I don't have the expertise to say if it was man-made, escape from a lab, or that it's synthetic. But what we can say, though, is that the WHO has said it was premature to arrive at the fact that it may have not been man-made, but the verdict is out on that. All right.
All right. My second question is, what's the possible long-term effect of the vaccine?
Nobody knows. In terms of, we say long-term is 30, 40, 50 years. No one knows. We say the long-term is 15 years, and they say, well, mRNA vaccines have been in study for at least 15, 20 years. So they would have some preliminary comment on that, but the long term, 30, 40 years, not sure. We're going to stop the meeting at 11 p.m. tonight, Jamaica time. So I'm going to try to get as many questions in. I know the appetite is still there. We're going to share this video on YouTube, and we're going to share different 2 other videos before this that perhaps if you're not answered in this session and you've not seen the videos, if you Google early home-based treatment Jamaica Dr. Hunter, you will see the videos coming up. So we're going to finish at 11 o'clock sharp tonight. So let's try and get as many questions in. So I'm sorry, I'm going to rush a little bit. Thank you. Lorraine Rainford.
I was just good evening, everyone, and thanks again for this forum. It's been absolutely amazing.
Thank you.
So many questions answered.
Go and talk about it.
Yeah, I'm going to be posting that protocol everywhere that I can.
That's it.
I can tell you about it for sure. A friend of mine is here, and she wanted to know, since it is that somebody posted in the chat that I know you don't talk about vaccines, but we just really want to have this one question, that it wears off after 6 to 8 months. Is it that it's then recommended that we get it every 8 months or every 6 months?
Well, the Pfizer vaccine, there are studies coming out to suggest that it's wearing out after 6 to 8 months. The AstraZeneca seem to be going a little bit longer than that based on the latest research I have seen. So the question is, yes, if it wears out, then the authorities will have to contemplate giving you a booster.
Or we hope that there's a therapeutic solution. We see there's one emerging from Israel today with an 80% success rate on critical care patients. So we hope therapeutics come to the rescue.
Okay, thank you very much.
Great, keep watching us. We'll post the next meeting. Nicole Samuels.
Yes, good night, everyone. Great presentation.
Thank you.
As you mentioned earlier about COVID-19 will be around for a while. I just want to understand with the reliability of the booster because of the mutation of the virus, can your natural immune system after a while become compromised and dependent?
I don't know.
Meaning unable to function or become unrespond?
Well, if the virus keeps changing, it will have something called immune escape. That's what all organisms try to do to live. They escape your immune system. So by changing, your immune system is not as effective. The immune response isn't as effective against the virus, because what's operating now, for instance, is not what operated last year. So you got COVID last year, you can easily get COVID this year and next year again.
So are you saying that the booster shot will not actually compromise the function of the immune system after a while?
I don't know. I don't have any data on that. Again, this conference is focused on early home-based treatment. We're not really vaccine oriented. So we need to do a discussion and see if we can take on a vaccine conference. We recommend the vaccine. We do not mandate it. We recommend it. We certainly don't expect pregnant ladies to be mandated with vaccines. That's other people have echoed that. We do not support that stance.
Understandable. Thank you very much.
You're welcome. Garfield Davidson.
Okay, good evening. Let me see if I can squeeze 2 questions in here. Are you familiar with the work of the FLCCC, the Frontline COVID-19 Critical Care Alliance? And what was that?
What are people involved? Names?
The FLCCC, Frontline COVID-19 Critical Care Alliance.
Which doctors are involved?
Dr. Paul Marrick, Dr. Pierre Corey, Eric Osgood, and others.
Not particular. I've heard about it, but not particular au fait with the workings and exactly what.
Okay, because they've been like publishing different protocols for prophylaxis, early treatment.
I think I saw one, and I recognize that there were some not deficiencies. There were some differences. But our protocol was driven from local experiential learning. So I think that protocol was, I think, coming out of a foreign land. So I think, but our protocol was developed based on our local experiential learning, locally in Jamaica. Okay, next question.
Okay, and then finally, what do you see? What role do you see memory T cells playing in immunity?
Crucial. They have been there from before. We just need to think of HIV. HIV attacks the T cells, and when you relieve you destroy your T cells, you destroy a lot of the immune system. So the T cells are absolutely critical. So when you get the whole infection like we had, like Dr. HAYMAN and I, we got our memory T cells also triggered, which you don't take, that tends not to happen with the vaccine. All right, so it's absolutely critical. All right, Damien, I'm gonna move on.
Okay, thank you.
You're welcome. Damien Hosef, gonna come again. Question, Damien?
Yes, sir, Hunter. Night. You had mentioned breathing exercise. That's something that wasn't.
Yeah, you want to specify?
Night, yeah. What is it about? What does it entail?
Well, yoga, people will tell you, I mean, long, deep breaths, taking like every 2-3 hours, you take about 20, 30, 40 deep breaths, breathing out through your mouth, in through your nose. And if you have steam, you can also inhale steam, but everybody can develop their own particular methodology. But as long as you're doing some deep breathing exercises, that utilizes your chest muscles, not just your diaphragm.
Okay, all right, got you.
You're welcome. Andrea Henry?
Another one also for breathing is to try to force out the air, more like blasting out the air. So you take a deep breath and you make one big blast. So you're trying to expel as much of the virus, and that will also is good physiotherapy for the lungs also.
Okay, thank you.
Thanks.
Andrea Henry?
All right, good night, everyone. And thank you, sir, again for this presentation and for all the other doctors that have contributed. My question is, when you do your first antigen shot, when are you recommended to do the second one? And when are you expected to get your results from the first one?
You mean a vaccine, your antigen shot?
Yeah,
antigen is a vaccine.
The test, sorry, your antigen test, the first.
Oh, you get it right on spot. Leroy, you want to answer that question? You offer the test, right? So
yeah, it's a rapid test, so you can get a reading within 5 to 15 minutes.
Okay, and also when do you do the second one?
The second one?
A week later. That's what I think Dr. HAYMAN said. He does them like a week apart.
You mean, well, I don't do another one, but I mean, if you want to see if the virus is cleared, then you can do it maybe 14 to 21 days after.
Well, I'm actually going by the recommendation of Dr. my doctor that's on tonight, who's the host of this. He recommended that I do 2 or 3 before I get the vaccine. So
that's ultra conservative. Yes, absolutely.
Oh, okay. That's what you're talking about with regards to the vaccine.
Yeah. Remember, we had negative day 1, negative day 2, negative day 3. So the closer the days are, it's probably still be negative, and then day 4 you become positive. We see that. That's why the bubble concept was they had to keep testing and retesting the athletes. But you had suggested, Leroy, and correct me if I'm wrong, what you would do is test them a week apart, and so you tend to get most of your positives by then. So if you're negative a week later, then you're probably truly negative. But it's something you have to go through.
Okay, and another quick question is, which vaccination are they giving us in Jamaica? I'm not sure.
AstraZeneca, I think there's J&J is to come, and well, for the kids now, it's Pfizer vaccine. All right, thank you. Ronaldo's iPhone.
All right, thanks. Thank you.
You're welcome. Thank you. Ronaldo's iPhone.
Okay, my question, if you can hear me.
Yes, you can, loud and clear.
I think a lot of us Jamaicans, unfortunately, got COVID and wasn't able to do a test. I wasn't available at the time. My question is not so much early treatment, but treatment after the fact for like long haulers who don't have severe symptoms like mild heart palpitations here and there, fatigue. What kind of treatment is suggested for the long haul?
Okay, Leroy, you want to take that one?
And also, is there any concern about blood clotting for those who have gotten COVID-19 in the past over time?
Blood clotting is mainly the acute within the 1 month window. After that, you tend not to. But the whole business of the long haul, what to do, long COVID, Leroy, you want to tackle that?
Yeah, I mean, there are definite problems long-term with the COVID virus affecting the brain. So people get memory problem, they get dementia, it affects the lung. You get fibrosis, which is kind of hardening of the lung tissue, so you have difficulty breathing. It may affect the heart. You can get myocarditis, you can get infarction. So what we normally recommend is that as part of our follow-up, we do routine tests to see what is your status with regards to your heart, your liver, your kidneys, and then we recommend appropriate treatment for it. The lung, we normally recommend physiotherapy, ongoing physiotherapy. And what I've noticed with time, the lung tend to heal, but we don't have enough data yet. But one of the things I'm finding out is that as we go back to our early treatment, I mean, I believe if we're treated early and the outcome is very favorable, you are not going to get most of these complications. That's what I believe. We don't have the data yet to prove it, but there are treatments out, and we normally refer to the various specialties to get the appropriate treatment. The lack of energy that comes with it, we normally recommend you continue your vitamins, energy.
Heyman, sorry, would you be prepared to share your number through me? You want to, because a lot of people are asking for your number because they're based.
Sure.
Yes, definitely.
The last part of my question is I got COVID-19 in December of 2020 with little to no information as far as at-home treatment. And so with the variants popping up every few months, is there a YouTube video that we can go watch to see what at-home treatment we can do if we get exposed to it again?
This will come on YouTube, but there are two YouTube videos for early treatment that were circulated last week and the week before. If you just Google early COVID treatment at home, Jamaica, Dr. Hunter, your names, and you'll find it on YouTube. Just share, like, and prescribe, not subscribe, but prescribe. You can actually recommend it strongly to others as a basis for which they can at least structure some treatment. Okay, but obviously subscribe to all our videos so that they can reach a strength and can go further and further to continue to help. Okay, thank you, Ronaldo. We have to move on. Leon, let's see if we can clear all the questions tonight. Leon, Roslyn, is it Lion? Roslyn, Lion, or can you unmute yourself? Roslyn, Roslyn Stewart, Roslyn Stewart.
Yes, Rosalind Stewart here. I am a practical nurse. Worked in Jamaica. I had about half a dozen patients last year. I'm sure all of them had COVID, even though they were not tested, but all the signs and symptoms.
Okay.
And I nursed them at home and I didn't lose any.
All right.
I am in this
361-2686. Let's join our figures together. Well done.
Thank you.
All right. Sarah James Vaughn. Sarah James, you were recently treated for COVID. You're an early home proponent. Tell us your story.
Well, my parents are being treated by you, and Tayoma, who's on the call as well, has been supporting. But my question is about the link between parasites, malaria, and all the alternative treatments that are being offered, like ivermectin and hydrochloroquine. And as a herbalist myself, the herbs that I've been using are all that have been effective are also antiparasitic and antimalarial. So just wondering what the link is between COVID-19 and parasites.
Well, the only link that we know is that because ivermectin is an antiparasitic drug, but it has antivirucidal property. Coronavirus is not a parasite. It's a virus. It's a virus, different from a parasite, a larger organism. So not so sure we can draw much else from that. All right, gonna have to move on, Sarah. I'm glad your dad and your mom, they're feeling better. I checked in with them early today. And yeah, we're doing well. Okay, RN, can we get RN in? All right, we just have 2 minutes before we're gonna close the questions and then thank everyone. RN, oh, Simone Morgan, can we get Simone Morgan in if RN isn't?
Yes, good night. All right, so question about the monoclonal antibodies, remdesivir and ivermectin, or particularly about the ivermectin. I know there was discussions previously about doctors being authorized to or seeking authorization to use it.
It's available now. You can proceed to use, yes.
Okay, so all of those,
not in government hospitals,
and
the insurance doesn't cover it. So we still have a few more steps to go.
Okay.
And then monoclonal antibodies, if you're offered monoclonal antibodies, do take it. They work, they're expensive, they're not free in government. You have to go and pay for it. Cost about $250,000, but monoclonal antibodies work, especially at the moderate category. We're gonna have to do this again. Tioma, can we get you? Are you an early home treatment advocate now? Are you early home advocate, Tioma? Tioma?
Absolutely, yes.
Why? What's the evidence? Why are you? Tell us.
Well, because I have seen it assist very, very acutely with, again, Saran has, well, I won't even, well, I've seen it, the steaming work. I've seen the immediate response. I've seen that oxygen saturation. You know, you can't believe it till you see it. I mean, as soon as they actually did have some herb tea, I will say, and it rose from 84 to 91, and then there was the steaming, and it rose up to 99. And just all of the going into the sun was amazing.
Living witness.
And I was
living witness.
Yeah. Oh yes, absolutely, yeah. All of that really helps. So the whole, just taking a global approach, taking a wide-ranging approach,
don't shun the sun.
Approach,
don't shun the sun. Don't shun the sun.
That's right. The sun is, and it's different from taking vitamin D3. D3 is great. That's great, but the sun is greater, especially when you actually have it and you go sit in the sun. You just, you know, it's like you're a plant. You know, your body just responds to it very beautifully.
We're gonna have to move on. Thank you.
So. Got a question about, you know, that when people are treating AIDS, they induce an artificial fever sometimes in patients that are not feverish or not able to raise a fever. Do you think that would be, or has that been used as a therapy at all?
Well, by steaming, you're inducing a localized fever. So yes, we are actually making the body hotter. So in a sense, we give local fevers along the lining of the airway, which makes the virus weaker, and then the immune system can do the rest. So in a sense, yes.
Yes. Okay.
All
But
right.
you wouldn't,
We wouldn't advise. No, we wouldn't advise you to sweat out the fever as back in the day, because you can get seizures and death and convulsions. Like a patient with a temperature of 103, they can become delirious. So, you know, a mild low grade perhaps, but certainly not over 100. Simone, you have the last question. You had your hand up, Simone Morgan. No? Roddy, last question to you, Roddy. Thank you, Tayoma. Roddy?
Yes, good night. Good night.
Good night. Good night.
I currently have rheumatoid arthritis and I'm on hydroxychloroquine. My partner, someone at his workplace, recently tested positive for COVID. Because of the fact that I'm currently on hydroxychloroquine, should I anticipate any kind of symptom perchance he has brought it home?
All right, well, hydroxychloroquine is not an absolute preventer. It's actually a treatment for the immune system. So it's not like ivermectin, which may have properties to prevent, but it certainly can help to reduce your symptomatology. Hydroxychloroquine is a safe drug. It's been used for decades. And we'd recommend if you're rheumatoid, you continue on the hydroxychloroquine. People with rheumatoid on medication or autoimmune disease on medication, they've not done very badly once they remain on treatment and keep their autoimmune condition under control. So yes, stay on your hydroxychloroquine. I want to thank everybody for coming tonight. Unfortunately, all good things must come to an end, but I think it is safe to say that we have created some elements of COVID competence. And I'd like to say that we all are now COVID champions. By knowledge, we know where to go. There are videos that we've made open, freely available on YouTube. Like, share, and subscribe. Share early home-based treatment. Share, listen, take your time. The last video was 5.5 hours. Tonight's video, we're looking at about 4 hours. We thank you all for coming. You are absolutely amazing. Thank you. What you have learned tonight, I guarantee you, will make a great difference. Just enabling people with knowledge is going to allow them to be in a better space, a better place. And we definitely commend to all the powers that be that early treatment works. Early home-based treatment works. We thank you for coming. We thank you. We thank you. Go out and become COVID champions. I leave Dr. Leroy HAYMAN. Are you there, Leroy, to have the last words? Dr. HAYMAN.
I just want to sincerely thank you all for being on this forum tonight. I know you have learned a lot. We want you to take this message to your families. We want to take it to your church groups, to your various workplace group to help us get this message around. I'm sure you're all tired of the bad news we're hearing every day. Hospitals are overwhelmed, people are dying. And so let us all join in to help prevent this. So again, we thank you for being part of this forum, and we look forward to being here again, as Roger mentioned, 2 weeks' time to give more updates and more important information. Thank you very much.
Thank you. Thank you, Mr. Chairman. Good night, everyone. Go forth and share. Go forth and be empowered. Go forth and save lives. Thank you.
Good night, Doc. Good night, sir. Good night, Doc. Good night. Thank you. Thank you,
Good night. Good night.
Thank you.
God bless you, everyone. Many blessings. Many blessings. Thank you.
Thank you, guys.
Good night. Good night.
Good night, Doctor.
Thank you, Dr. Hunter.
Good night, everyone. Thanks, Trumpet Call, for making this possible as well.
This is wonderful.
God bless you.
Thank you, Doc.
Good
Good
or good
night.
person.
Thank you, Doc.
Bless you.
Thanks,
Thanks,
doctors,
thanks for coming.
for your
Go
sacrifices.
forth and tell. Go forth and tell.
Thank you, Dr. Hunter.
Yeah.
Thank you, Dr.
You're welcome.
Hunter, we
Bless
love
you.
you. Thanks for the
Rachel.
Thank you,
sacrifices
Doc.
you're
Blessings to
making, and
all.
God cover
Share
you and
with the
your
church.
family.
God bless you.
Thank you,
Thank
Lord.
you.
Doctor.
Night, everyone. God bless
Night.
you.
Dr.
Stay
Hunter.
safe. Stay COVID free.
Just a rundown. Appreciate your diligence.
And
Okay. All right.
hallelujah to the Lamb.